Good morning, and welcome to the 2020 Mental Health Conference. We are so glad that you have decided to join us today. We're going to start, of course, with a word of prayer, and then we're going to get right into the sessions. Our first session is going to be with Dr. Michael Barnes. God, we thank you for this day. We thank you for your loving kindness, your tender mercy, and your saving grace. We thank you for another year that you've allowed us to make it through. Touch as we go into this mental health conference. Let this be a successful day today. Let this be a productive day today. And let something that is said bless someone, edify them. God, and we just thank you right now. We honor you, we bless you, and it is in Jesus' name that we pray this prayer. I'll so say, Amen.
Amen. Amen.
So, as I said, we're going to jump right in, and I'm welcoming right now Dr. Michael Barnes. Good
Hi, good
morning,
morning.
Dr. Mike.
Good morning, Lydia. How are you?
I'm wonderful. How are you?
I'm good. No complaints. Not at all.
I am I am super happy to have you here with us today, and I am just sitting in anticipation of what is going to be taught on today. So, without further ado, I present to some and introduce to others Dr. Michael Barnes.
Thank you very much. Good morning, everybody. And let me just welcome you and thank you for being here. You could be anywhere, but you chose to share the day with us. So, welcome. Um, Before I go even into my presentation, I just want to thank the producers of today's show and the sponsors of today's show, basically WSB Legacy Fellowship and also HDK Productions. Thank you very much for doing this. This is, and I'm not saying it just because I'm in the profession, but I'm saying it because it's been such a topic that's been somewhat taboo, especially in many of our neighborhoods and communities. And it's so important in the words of the producers today. Mental health matters. Now, what I do typically when I'm about to make a presentation, especially when we're talking about a particular topic, I usually try to define it first and make sure that I understand exactly what it means and I can share that with my audience. So I went to the dictionary and I looked up mental health. Now, I already had some ideas about what mental health represented, but I went anyway to look at it, and I want to read you the definition that I found. Mental health is the condition of our emotional, psychological, and social well being. It reflects how we think, feel, and act. It determines how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Now, I want to point out two things about this definition. One, I want to emphasize it reflects how we think, feel, and act. And I want to put emphasis on think, and you'll see how that plays later on in my presentation. Um, the second thing I wanted to point out was that this definition is I was surprised at how positive the definition was. Because typically, when we think about mental health, as soon as somebody mentions mental health, our minds go to mental illness, not to mental health. It kind of reflects the negativity that's so prevalent in our society today. And I'm going to speak a little bit about that a little bit later. So here we have this whole notion of mental health. And in order to determine mental health, there has to be some sort of assessment, typically made by experts, but also made by ourselves. So, assessing mental health allows for a complete picture of one's emotional state. It allows for someone to determine how you're able to think, reason, and remember. Now, depending upon where you go, for example, if you go to an institution, if you go to a mental health clinic, if you go to a hospital, there will be different things incorporated in a mental health assessment. But common to most of them is a clinical intake, which includes a detailed history, some sort of a clinical interview, which contains things like mental health status, level of consciousness, expression, the appearance of the person, and so on. There typically is in a major formal assessment, there is some psychometric testing. So some comparison of you to others in your same age or same ethnicity and so on, but some sort of comparing of you to normal people using standardized testing. In typically a hospital setting, you'll see these other two things. One, maybe some laboratory testing. Two, some sort of multidisciplinary approach to an assessment, including other people like nurses, social workers, and such. Now, before any kind of formal assessment is done, typically there is an informal assessment to determine the worthiness of a formal assessment. Sometimes it's the assessment of the self. Sometimes it's the assessment of other people's, especially if you're a caretaker. Now, when I looked this up, it definitely went into what I had expected. And one national mental health organization stipulated this. These tools, now I'm talking about informal or self-assessment, these tools look at or look for signs or symptoms that can show up in some mental health issues. They can also help you look at patterns of feelings of substance abuse. They typically refer to signs of mental problems, such as anxiety and depression, and are typically associated with regard to a reaction to some event or situation, such as one losing one's job or something, some such. And these things are referred to when it's a response to a situational event, it's called situational anxiety or situational depression. These are contrasted with clinical anxiety and clinical depression, in which that would probably result in a formal assessment. Now, I want to point out a couple of things because this is really at the crux of my issue. This national mental health organization came up with guidelines, questions that people can ask themselves if they're doing a self-assessment, or things they can ask of others if they're doing an other assessment. Number one, how did I feel prior to this situation or event? If you were doing well before the event, your anxiety or depression is considered situational. Do I often find myself feeling anxious or depressed during stressful times? If the anxiety subsides or the depression lifts when the stress is over, then it's probably a situational one. During difficult times, this is number three. During difficult times, does hopeful news lift my spirits or put me at ease? If so, then this is situational anxiety or situational depression, because they're usually eased by hopeful news. And then the fourth question that they say one could ask themselves or ask someone else, am I able to cope? Now, this is a great question, but not for the reasons that it was devised. This question was devised to help people differentiate between situational anxiety and depression and clinical anxiety depression. But it overlooks one thing that I think is so critical in the area of assessment. Both of these assessments, both formal and informal slash self, they all do the job of detectives. They require one to look and search, but they're looking and searching for problems, and they accentuate problems. They fail to call attention if the person, for example, is able to cope. It fails to answer the question as to how they are able to cope, which is critical. So, assessment and techniques and methods, as far as I'm concerned, accentuate the shortcomings and weaknesses of a person. But what about their strengths? They end the evaluation or assessment with reporting of only the circumstances or the lack of health. There's nobody that has zero health. Number three, they barely recognize the successes or adequate functioning of the individual. And I'm sure there is some good stuff going on in spite of the bad stuff that's going on. But these assessment techniques also, number four, they rarely emphasize hope, which is crucial to both prognosis and success of the individual. And number five, they are guilty of labeling a situation, labeling a circumstance, labeling a status without providing possible solutions. So, what I'm saying is in the matter of assessment, I advocate pointing out strengths of the individual, which I believe should be a part of any worthwhile assessment. In fact, read inventory. When you read assessment, read inventory, because any inventory not only takes account of what you don't have, but it also takes account of what you do have. And if you're in a formal situation, a formal assessment situation, and I'm assuming, based upon my experiences, that not much attention is going to be placed on the positivity, on your positivity, you are in a position to bring up your positivity. You can bring up your strengths. You can bring up how you are able to cope. And I also advocate something that I call addressing of the situation subsequent to the assessment. And we're going to get into the addressing of the situation, addressing mental health in just a minute. But first, I want to introduce you to an example. And I run the risk of someone saying this is an oversimplification. And it probably is, okay, but you have to start small in order to work up to bigger and better things and more complex things. But I just want to point out something. And the point I want to make is, the point I'm trying to make, is that most of our psychological and emotional difficulties that we face are due to faulty thinking. Faulty thinking. For want of a better term, I call it stinking thinking. So let me give you a situation to consider, all right? Because I want you to understand that thinking plays a really big part in terms of how we feel and how we behave. All right, I have a situation where two people are fired from the same long-standing job. A terrible situation, no doubt, no doubt. They both are crestfallen. In a word, they're depressed. Neither one has the ability to construct a means of responding in a positive manner, or so it seems. Neither has an alternative plan. Both feel lost, and you can understand why that would be. Now, person number one does a tailspin. Person number two also does a tailspin. But person number one maybe even engages in some other self-destructive behaviors, or just feels lost, or just feels stuck after spending so much time on the job and now it's gone. Mastering the skill that now seems unnecessary. Maybe even that person feels somewhat unnecessary. She or he may even feel unwanted. Now, person number two, after some consideration, looks at the situation and she or he recognizes that just surviving the situation is a blessing. And surviving the situation provides an opportunity. Even though they're still somewhat disturbed, they manage to have those thoughts. It's an opportunity to engage in searching for another, who knows, maybe even a better job. But you can see that there's a difference in the way these people think. One's thinking is such that there's no hope. The other's thinking, perhaps this isn't as bad as I thought it was. They're both in a predicament, but one thinks of it as an opportunity. The second one who looks at it as an opportunity, and while they initially saw it as a defeat, they no longer sees it this way. She or he has learned to cope. Now you can imagine the mental health of these two, quite different. While they have assessed the situation in the same way, they're probably going to address it in very different ways. Different ways in terms of their emotion, different ways in terms of their behavior. Now, I know I run the risk of some people, like I said before, thinking that this is an oversimplification, but I'm just trying to point out the importance of thinking in terms of how we behave and how we feel at the end. And guess what? I challenge you to remember situations in which you were able to cope. Somehow the way you assessed the situation and addressed it, resulting in your feeling better and moving on. In my practice, I attempt to help people change the way they think. I call it changing their stinking thinking. I attempt to help them address the way they see the situation. And some of the situations can be dire ones, and recognize the positivity and the hope, even during the assessment, then they can address during the addressing of their situation, despite their circumstances. My goal is to teach them how to increase and improve the health of their mental status. In addition, I attempt to point out their strengths, which is pertinent to any good assessment. So what do we hear? Here's a situation that I'm suggesting that a person, even at the assessment stage, even when they're coming in with a complaint, even when they're coming in with the problem, if you will, depression, anxiety, whatever, they can also talk to their strengths. They can also reflect upon the times that they were able to cope with other situations, maybe not as major as this one, but coping, because the coping skill, the coping muscles are what I'm trying to address. And they have them, they just need to be developed. They've used them before, they just need to be developed. Now, this I want to point out as well, okay? We always talk about what they could do, what they should do. They could do this, they should do that, as though we have no responsibility, although as though we have no part in doing anything. All right? And you don't have to be a caretaker, and you don't have to be a mental health professional to do some things that help someone else's mental health. So, have some things I want to point out. One, you can draw attention to someone's strengths. If you're not aware of them, you can inquire. If you're uncomfortable with inquiring, you can suggest that they inquire. You can suggest that they look at themselves and think about all the things that they're able to do. Okay? Because all of us have strengths. Number two, you can encourage them by giving them hope. I found that there are at least two ways of thinking about things. Choose the one that provides or includes hope. Number three, point out ways in which they are demonstrating good mental health. I'm certain that there are some good practices that they exercise and enjoy. It reminds me of that poster, if you've ever seen it. If you worked in an elementary school, I'm sure you've seen it, or even if you went to a pediatrician's office, you've probably seen it. And it says, catch your child being good. Okay? What I want you to do is point out to individuals, maybe even point out to yourself, how good you are and how good you have been in certain situations. Number four, some situations require additional resources. I'm under no illusion in terms of just changing thinking might be the end all be all. Some situations require medication. Some maybe even require hospitalization. But there's an answer that lines up with hope. And you know how I know? Because that's the kind of God that I serve. He deals in hope. Number five, and he always provides a way. Number five, do not be discouraged if another person, or even if yourself, if you don't respond or they don't respond positively right away. If you're dealing with others, while they may not admit it, they are grateful for your attempt. And remember, even if they respond negatively, God is pleased with your try. So, good mental health not simply is the absence of diagnosable mental health problems. It's characterized by a person's ability to fulfill a number of key activities and functions, including the ability to learn, the ability to feel, express, and manage a range of positive and negative emotions, the ability to form and maintain good relationships with others, the ability to cope with and manage change and uncertainty. When doing any kind of assessment, look at how another individual or yourself is good. Give yourself grades on these and give yourself that positive pat on the back as you move forward to address the things that need to be addressed. And last, I want to leave you with something that's a little bit off topic, but still is important, and I would be remiss if not pointing them out. I've listed 10 practical ways to look after your mental health. 10 practical ways to improve or maintain good mental health. Number one, talk about your feelings. Interesting, we're never encouraged to talk about our feelings, but I'm here to tell you that it's important that you learn to do that. It's important to your good mental health. And to be honest, your good physical health as well. Number two, keep active. Number three, eat well. Number four, drink sensibly. Number five, keep in touch, especially with those others that tend to help us buffer ourselves from negativity, from negative situations. Okay, in the words of the rapper, get down with the people who get down with you. Ask for help. There's a reason why God created more than one individual. Okay, we need each other. If I could, let me reference you to Romans chapter 12. Some good reading there. And it's important that you understand the importance of others. Okay, we all have strengths and we can all benefit from others. Take a break. Sometimes we think that we can just go and go and go and go, and then we'll get burnt out, and then we wonder why we're suffering so physically and mentally. Take a break. Number 8, do something you're good at. Okay? Doing something that you're good at tends to reinforce your positivity. It definitely lets you know, hey, I can do something, and I can do something well. I may not be able to do what she can do or he can do, but I can do this. And who knows, it may wind up being very, very lucrative even, who knows. Accept who you are. First you have to check out who you are, and then accept who you are. Accept your weaknesses. Identify your strengths. Build your weaknesses using your strengths. And then the last one may even surprise you. Care for others. You will be surprised at how caring for other people is really, really beneficial to your overall mental and physical well-being. Okay, with that, I will conclude. And thank you very much for your attention.
Dr. Mike, we are so happy that you are with us.
Thank
Um,
you.
Before you end, I want to leave the floor open just in case people want to send us questions online that they may
Definitely.
have. While we're talking, I was listening to your session. I will tell you that I found it very personally. Your session was great, of course, as always. You know,
Thank you.
I've known you all of my life, of course, because you're my uncle. But you always give us such great information about what is necessary, especially when it comes to mental health. And I love the way that you pepper in the word into your seminar. No,
Thank you.
seriously, some people don't do that. They don't pepper in the word. And as much as we are being professional, we still want to make sure that we honor God. So I appreciate you for that. So what I was going to say before I said that I wanted to get in here is that uh, I've noticed over the years a lot of people, you know, when they are assessing your mental health, as you said, sometimes they jump to conclusion and goes one way. But before I do that, I do want to we do have a question.
Okay.
So our question is, what are some warning signs that indicate your mental health needs assessing?
Okay. I would say, number one, I would advocate that we do periodic assessment of ourselves, okay? Because there's nothing like checking in. It's funny how we do that with everything else. We take our cars in for periodic checkups. We take our bodies in for periodic checkups, but then we don't check out our mental status. We don't check into that. You know, we assume that everything is okay. If we're okay, it's okay. So, but I think that if you are finding yourself struggling to cope with situations, especially if you're confronted on the regular with stressful situations, things that kind of um, push your faculties, push your strength. Caretakers, for example. Um, if that's the case, parents, for example, if that's the case, then definitely you need to do an assessment. Um, but if you're finding that you're not functioning well, if you're agitated, if you're aggravated, if you're not getting along with people in your environment, okay, these are warning signs. All right, it may not be them. It just might be you. I have a short story. I have a short story to tell, if you don't mind. Okay.
Oh, please,
Um,
please. We
I,
have
I
more
hope
time,
I
so
I
go
hope I
ahead.
answered the question. But but I had a parent to call me. This was years ago. I had a parent to call me, and as I have developed, I've been in private practice. I was looking at the number the other day. I've been in private practice for almost 40 years. So I can't even say that I'm 21 anymore, right? If I'm in practice for 40 years. But at any rate, I found that I had started out wanting to deal primarily with children and in a school environment as well. And then I evolved, if you will, over time. And I found out that I can't deal with the child without dealing with the family. And that may mean the mom, the dad, the grandma, everybody. Okay. But here's the deal. So this parent called me up, and she wanted, and I'm gonna just come up with a fictitious name. She wanted me to see Johnny, as my client, because Johnny had done something in school and gotten in a lot of trouble, and she wanted me to see Johnny and try to figure things out and help him out. So I said, fine, no problem. I said, and this is like doing my intake. And I said, but let me just tell you the way I work. I may want to see not only Johnny on occasion, I may want to see mommy, I may want to see daddy, I may want to see Johnny's brother, sister, whatever. I may want to see everybody, or I might just want to see somebody else other than Johnny. Are you ready for that? And she said, and I imagined, we were on the phone, but I imagined with her hand on her hip saying, uh, I'm bringing Johnny to you. All right. I don't want to see you. I want Johnny to see you. Did you understand me, Dr. Barnes? I said, I understood you perfectly. But I want you to understand me as well. All right. Because it's important that everybody understands Johnny's position, Johnny's makeup, and you don't undo the things that we're doing. All right. So, so she hung up the phone and she said, well, thank you very much. Goodbye. I said, okay, fine. All right. So about 6 months later, she calls me up again. She said, you probably don't remember me. I said, oh, I remember you. I said, how's Johnny? She said, well, I'm not calling you about Johnny. I'm calling you about Tony. I said, oh. And then she told me about why she was calling me about Tony. I said, okay, can I ask you a question? She said, well, I said, who do Johnny and Tony have in common? And she said, you're funny, Dr. Boss. I said, oh, I'm funnier. You wait till we do this. you wait until we do this. I said, we're going to do this? I said, but I just want you to know nothing has changed. okay, I still operate the same way. So you have to be prepared to be open to talk to me and allow me to be able to talk to whomever is willing to talk to me. I'm not going to force people, no question about that. But I do need access or possible access to everybody that impacts Johnny's life, Johnny and Tony's life is good for. Okay, and I want to have access, if you don't mind, if it's what if I think it's going to be relevant to his teachers, you know.
Right.
I want to be able to be helpful in any way possible. So I may need access to a lot of different people, but we'll see as time goes on. But I need to open this whole relationship with that flexibility.
Yeah, a lot of times it seems like we look to point at everyone else before we think about what may be going on with us, you know. And sometimes
Absolutely,
you just need somebody to talk to, really, because
absolutely,
you're full.
absolutely,
You know,
absolutely.
what I was going to say earlier is I realized after the move from Maryland to North Carolina, I was full. And I didn't understand that I was full. I was like, I'm here and everything is going on. And when I realized I was full and I had listened to a couple of the sessions that I actually produced, I was like, I might need to talk to somebody myself. Because it's amazing, though.
Yeah, yeah. To go back to that question too,
Hmm.
we use terms, and I'm triggered by what you just said. We use terms that we just use them, and we don't even pay attention to the fact that we're using them. But there's something to the term of well adjusted. Okay, so if you're not well adjusted to a situation, to an environment, to a relationship, that's when you definitely need to do an assessment. And don't forget to conclude your positives too. What you need to do, and you need to do an assessment at that point.
Absolutely. Dr. Mike, I cannot. Oh, hold up. We got another question.
Another one?
I was
Okay.
about to let you go, and we got another question.
Okay.
All right. Question is, do you have any recommendations for ways to suggest to a loved one that they may need mental health, well, a mental health assessment?
Okay. Um, that's a very touchy issue because and you've just made the point that when you're saying that sometimes you're the last one to see yourself. All
Mm-hmm.
right. The one thing that I found with people in terms of trying to sell something, anything, you have to talk about the benefit that it has to them. If they don't see it as being beneficial, then they're not going to buy it. They're not even going to venture into it at all. So, if you're gonna sell this idea, if you want to make them more susceptible to buying into it, you want to talk about the fact that they are going to benefit from some of the burden that you see them carrying right now. Okay. And I'm sure, I am certain, I am certain that people are aware of the burden. They may not know what to do about it, but they know when they are burdened. They know when they are being weighed down. Okay. So you want to empathize. You want to let them know that that they're going through something. All right. I've not had anybody like slap me and, say, oh, that's an insult that you pointed that out. No, they feel good that they know that somebody sees the struggle that they're going through. And then say, um, I got a suggestion. And then even offer to do it with them.
Yes.
Okay, to offer to do it with them, to offer, and they may turn you down. They may turn you down. But guess what? The one thing else that I found, even dealing with children, if you plant a seed, you have no idea when it's going to grow. You have no idea when it's going to develop. And they may not ever talk to you about it. They may They may slam the door in your face, but they may go to a friend and say, guess what? As if they came up with the idea. Guess what? Would you be willing to blah, 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 blah? Or guess what? Somebody said to me, and slamming you. Guess what? Guess what so-and-so said to me in so many words, you know? And that person that they're talking to might say, well, not a bad idea. Now, this person, they're open to, okay? But you planted the seed. So what am I saying? Don't be afraid to plant the seed, but it's the way you go about it. Remember, some people, this whole topic of dealing with therapy and talking about mental health is something that we did not grow up with. I did not grow up with. I tell a story about a man who came to my office, and the first thing he said, now I knew his wife and I was dealing with his wife, but he finally came. And he looked at me, and after a few uncomfortable minutes, he goes, well, I thought that you would be Caucasian. I said, well, that's not, that myth is over. But I'm saying that, you just never know. You never know by planting a seed and showing how it may be beneficial to somebody. You never know where that's going to go. And honestly, that's our job. Somebody clearly told me when I was getting frustrated when I was teaching, they say, you can't make somebody learn, but you can teach them. And you can teach them the best way you can.
Well, that's the thing. Even with preachers, you can't make people do the right thing. It's only your job to give the word and then watch God work.
There you
So the
go.
seed is planted. You said, like it says, one plant, one water, and God gives the increase. It's the same thing with our mental health. Even if you're not the person who moves them forward, at least you plant the seed. Somebody else might have to water it, and then God will let them know it's time for you to move. We have
Okay.
one more question, Dr. Mike.
Alrighty then.
Okay, here we go. Oh, hold up. Put it back up. All right. The question is it ever considered too late to address our mental health?
Never. Never. I don't know how to emphasize that. Never. I have clients as young as my youngest client now is about 9, I think, maybe 8. My oldest clients, the couple, and the husband is 73 and the wife is 68. And you say, oh, well, old people, they're probably, they ain't have any problems. They've been married for 30 some years. Just saying. Okay. So no. It is never, ever, 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 ever. Okay? Never. It's just like people don't even understand the comparison between mental health and physical health. It is never too late to address physical health. We'll go further. It's never too late to address spiritual development. It is never too late. It's never too late to grow in any and every regard. Never, never, never too late.
Right.
I will say it gets a little bit more complicated with the amount of experience that one has. It may have to it's kind of like heart surgery. You got to move everything out of the way before you get to the heart. There's a lot of stuff to unpack. That's one of the reasons why I wanted to work with kids in the first place. Just saying, okay. But no, it's never, never, ever, never, ever too late. And I want to make a confession before we go on, because otherwise at my age people forget. So you talk about me sprinkling in scripture in my presentations. I sprinkle it in my practice. I tell people, I talk about Jesus to Jews. Okay? And I don't try, and I'm not trying to convert or proselytize, but I want to talk to them about where I'm coming from and what gets me going and where my inspiration is derived from. Okay? And even as I was doing this presentation, Romans 12 came to me, right? And that last verse talks about overcoming evil with good. And my whole message here was talking about trying to overcome negativity with positivity, even in the assessment, even at the assessment, where it's all about what's your problem, okay? Even in the assessment, there's a room for positivity there.
So we got one more question.
Okay.
All right. But is it more difficult to treat in seniors?
Yes. I'm gonna say yes. Um, doesn't necessarily there are going to be some individual differences. There are going to be some very very easy to deal with seniors, but like I was just commenting before, when you have a lot of experiences, you got a lot to unpack. You know, um, typically, you know, people have been operating under some false assumptions, and some of them they've been rewarded for, you know, and especially not so much now because I'm a senior, but when I was younger, it was kind of like, what, how you gonna tell me anything? You know what I'm saying? But age can be tricky. I tell you what else too. Any difference, cultural differences, is going to also be an issue. Okay, so yes, seniors a little tougher, generally speaking. People of cultural difference going to be a little bit difficult, generally speaking. Um, like that, and you might even think, as I'm thinking about it, that adolescents may be difficult to deal with. But some of my best clients are adolescents. They take notes during session. They do their homework. Yes, I give homework. Okay. It's more than just the one time a week that they see me. There's stuff that comes in between, just like school. Okay. So, but I have some really, really excellent adolescents. So, yeah.
Well, I am again so very happy that you joined us today. I'm also
It's a,
happy that we are continuing the conversation because in our culture, in our ethnicity, a lot of times we don't have the conversation about mental health. And with today's climate, just our climate as it goes, we need to have these conversations. We need to equip our young, old, middle age, everyone needs to be equipped to understand that mental health really does affect us all. The
really,
strongest person needs to talk to someone at some point and understand that even when you're talking to your friend about your situation, you're dealing with your mental health.
you are.
Sometimes we think if we're not going to a doctor, we're not dealing with it. Absolutely not. That
No.
conversation you had with your best buddy is about your mental health.
Okay.
Dr. Mike, I was going to let you go, but I got another
Got another
question.
question? Okay.
Here we go. Is is it best to talk to someone before physically reaching? I'm going to say reaching out.
um, I'm not certain about being definitive about the answer here. Okay, because it really is a matter of who and how receptive and how responsive. Because some people can be quite negative, offer bad advice and that kind of thing. So it a lot depends. A lot really really depends. Right. Um, and I hate to duck the question, so to speak, but it's a good friend, a person that is empathic, a person that is responsive, a person that can be positive in spite of, you know what I always look for with people, a sense of objectivity. What does that mean? There's negativity and there's positivity with everything. Okay, but if somebody is only talking about just the positive or just the negative, then my antennas go up like, wait a minute, hold on. That. And so you have to be careful. But if you have a friend that can say, you do this, you do that, you got this going on, blah, 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 but this needs to be addressed. That's the kind of person, if you want to go to someone first, that's the kind of person that you want to go to. And also a person that can keep secrets.
Yes.
A person that will be that you don't know, no, but a person that you have every reason to believe will hold whatever you're saying to them in confidence.
Right.
Okay. So, but if you don't have anyone like that on board or nearby, then you want to get yourself over to a professional that is duty bound to hold your things in confidence.
Absolutely. Absolutely.
Okay.
I think we hit it this time, Dr. Mike. I think we hit
All
it.
right.
Up. Let me see. Let me see.
Another question.
Okay. So he clarified his question. Is it best to get to talk to someone before physically reacting?
And I'm assuming that means like some sort of aggressive,
Sounds
aggressive.
like it.
Yes, it sounds like it does. But most definitely, most definitely. I have to tell you, one of that's what it sounds to me. If that's not true, then they can clarify that too. But when my kids were growing up, I told them, I said, most times, when kids go to school, you say, if anybody touches you, if anybody hits you, hit them back. I told my kids, I said, no, no. If anybody hits you and you don't like the fact or the way in which they hit you, before you hit them back, make sure that you're reading it right. Make sure that you're interpreting it correctly. Make sure that they just hit a little, it's not just that they hit a little bit harder than you do, but they're still your friend. You want to clarify, don't hit me that hard. Okay? All right.
Exactly.
If you're going to touch me, don't touch me that hard. But don't just hit back just because. Don't make it an automatic reaction. Okay? Remember, I was talking about thinking? I want the thinking to come in between the situation and the reaction. Okay. Think about what's going on. Think about who this is. Think about what they're doing. Make sure you might have to hit them back, but no.
Please don't hit them
but,
back. Please don't hit them back.
but please, no. But don't hit them back like right away. Talk to me first, if you can. So hopefully that answers that question. But
I think
definitely, no, no, no.
so.
You don't want to do that.
Dr. Mike, this has been a great session. I've enjoyed it. The session and the conversation. Um, it has been very lively. I appreciate you. I appreciate you joining us and opening up this panel for us, this
Thank
conference for us this year. I'm sure we will see you next year because that is,
you.
uh, wait a minute. They really like talking to you.
We got another
I
question.
want to ask this one last question, and we really gonna have to go, guys, after this one last question. This last question is: how do you distinguish between whether it is a bad habit or a mental issue, i.e., washing hands over and over again?
Okay. Um, if it's something that, okay, I'll just do it like this. Washing hands is important, all right, especially nowadays, especially given our pandemic. But there's a point where it's excessive. Okay, just like anything else. Okay, when it's excessive, my guess is that it's probably a mental health issue. Okay, here's the question: can the person stop? Okay, typically we're talking about a compulsive act if it's a mental health issue, and typically with that compulsion, um, it's usually ritualistic. Okay, so a lot of times it's I got to do it 5 times, I got to do it 7 times, I got to do it 10 times, and that kind of thing. Okay, that's definitely if it's that kind of pattern, it definitely is a mental health issue. Okay. Um, if it's more than what's typical or what's required to have the person's hands clean, even if it's a bad habit, it needs to be corrected. Okay. It's just not healthy. One of the things that's important, how do I say this? We talk about mental health and incorporating your social relationships. If you're doing something that's excessive and you're dealing it in a social environment or in the presence of other people, you're going to be judged and it's going to affect your relationships with people. So, if for no other reason, call it a bad habit, it's going to result in a bad outcome. Okay? So, my guess is that it probably is a mental health issue and it needs to be addressed.
All right. We're going to end there. There are more questions, but we're not gonna put those up now. They
Okay.
can
You,
they can
you do have so
contact you.
much.
How can they contact you, Dr. Mike?
um, I can give you my phone number. I can give you my email address. You know
Let's
what? What
go.
I can.
Let's go with the email address.
Okay. All right. Don't laugh. It's PS as in Sam, Y as in yellow, C as in car, H as in Henry, E and then Mike, Mike at AOL.com. Okay, so
AOL.
it reads Psych E Mike. That is not to be confused with Psych O Mike. I'm not Psych O. It's Psych E. PSYCHEMIKE at AOL.com.
So if you have questions, you can use this email address to contact Dr.
Absolutely.
Mike Barnes, and
And
I am
oh,
sure
oh,
that he will answer your questions.
I
Thank
will.
you so much, Dr. Mike. We are
Uh,
going to have to move on. Um, I will be
Thank
in
you
touch.
for this opportunity. Thank you so
Oh,
much.
oh, I wouldn't call anyone but you first. I'm telling you, I'm always gonna call you first. So thank you so much. This has been so informative, and we really appreciate it. Um, we are going to go. I will definitely give you a call before this day is out, uh,
Okay.
and I will talk to you later. Everybody who joined the first session, please don't leave. We have so much more coming. Join us for the rest of the day for Mental Health Conference 2021. Mental health affects us all. Thank you. We're going to go into the next section, and you have a wonderful day, Dr. Mike.
Thank you so much. And you as well.
In our next session, let's go. Our next session is the nurses session, and we're going to talk about the stress of being a caretaker. So, if you give us about 5 minutes, we're going to set that up, and then we're going to get right into our next session. Good morning, everyone. Can you hear me before we start? Good morning. Can you hear me? Okay, I see. Uh, Tammy, can you hear me? Good morning, ladies. Can you hear me?
I can hear you.
Okay. Need to do this quick sound check because I want to make sure that everyone can hear me. Um, this is our nurses session, and we are about to start. I appreciate you ladies
Okay.
being here. You are always. Can you see me, everybody? I just want to make sure we're clear before we get right into it.
I'm just trying to get the ring light off my glasses.
Okay.
Is Teresa joining us?
We're live, so I think she's going to join us, but we're going to start without her right now and move forward. And if she pops in, we're going to pop her in. And that's what we're going to do. Okay? That's how we're going to work that. Um, so we just want to get started because we want to stay on schedule. And it is 11:01. So I am so happy to be here this morning with the Nurses Corner with Nurse Tammy and Nurse Elisa. They were here with us last year, and they were just so great. We enjoyed them tremendously, and we are going to let's see, get her back in here. There she is.
I am here. I switched to
Um,
another device so I could hear.
that's okay. That's okay.
Okay.
We are
Are you
here.
able to hear me well?
We can hear you great. We can hear you
Okay.
great. We are here and we're going to start this conversation on the stress of being a caretaker. I'm
Hmm.
dealing with the stress of being a caretaker. I am going to turn the floor over to Elisa and Tammy. I'm actually not going to be in the conversation this morning, ladies, but I think you guys can handle it. You're professionals. Um, and I will come back at the end. I appreciate you both. Again, Nurse Tammy Saunders and Nurse Elisa Davis. Thank you for being here.
You're very welcome. It's
You're
our pleasure to
welcome.
come on with you.
Hey, Tammy.
Hey, good
S-
morning. How are
Good
you?
morning, and good morning to our audience. We're very honored and privileged to be able to participate in this conference. We thank you. Special thanks to our host, Lydia Chapman, for pulling this all together. This is such a needed session and topic, so that we can get information out amongst those that are in this particular scenario of being a care giver.
Mhm.
So I know that we were looking for one more person to join us, but we'll proceed.
Mhm.
And we'll just say, good morning. Our topic is stress as a caregiver. This is the Nurses Corner. And,
Yeah.
nurses, we are
Mhm.
caregivers by profession
Yes.
and probably naturally
By
as a
nature.
calling because it kind of hand in glove with just being able to take care of folks. And there are stresses that are related to that gift. And with that said, we want to share some tips and cues with you all um, that will definitely, hopefully, will strengthen you, encourage you,
Empower
be
you.
totally a blessing to you.
Hmm.
We appreciate what Dr. Mike shared earlier in the first session, and we're
Yes.
going to hopefully enhance in those things that he shared with you all as well. So, to start, we'll introduce ourselves. I'm Elisa Davis. I've been a registered nurse for over 25 years. It's probably longer than that, but I'm not going to say that. I heard Dr. Mike say he was 40 years. I said, I'm not going that hard.
Okay.
It might be stressful for the caregiver. So we're going to just say, I got a lot of experience in all
Mhm.
aspects of healthcare, from the administrative side to the bedside, um, and all ages, from pediatrics to geriatrics, is something that I was, very fortunate to be able to um, provide nursing services in those age groups. And so, Tammy, tell us about yourself.
I am Tammy Saunders. I am an LPN. Have been so for uh, a little over 40 years. And I have served in various capacities, just as Alisa. As a matter of fact, at one point, Alisa was indeed my supervisor, and I really enjoyed working under her and with her. Um, Now, what I do this late in my career, is to assist families when they have to make difficult decisions. I hear diagnosis from physicians, and I help families translate this into workable stuff. Even if physicians are talking all the way up here, as a nurse, I'm able to break that down, and I'm also able to, in some cases, be a resource for I don't understand what they said. And so when families have to make difficult decisions, be it a diagnosis, be it a change in the level of care, I'm kind of the go-to girl with stuff like that, so that I can kind of make it easy for you to eat the elephant in the room, but only in bite-sized
Exactly.
chunks. So that's what I do.
Exactly. So yeah, thank you for that. It gives us, hopefully, we're giving you the audience, opportunity to understand our background and what we're planning to share in this hour. Um, So, one of the things that is real important, well, first I want to start with this factoid that November is National Caregivers Month. So, how great is it that we're
Absolutely.
sharing this ahead of time so that people can get plugged in?
Mm-hmm.
So, I guess that makes us the alpha people, the beginning, and get things started.
Mm-hmm.
We will be putting up some information of one organization. It's called Caregiver action.org, and they have a great website with
Yes.
tools, resources. You can even give them a call and get assistance. We want caregivers to understand that you're not alone. And
Absolutely.
oftentimes, when we are stressed out, is sometimes because of a lack of knowledge or a lack of tools and resources.
Mm-hmm.
It could be even our perspective about what we're doing. I had a family member totally take care of their parent, their loved one. I had a couple of family members that are doing
Mm-hmm.
that, and they have over the years built in these little strategies, mechanisms for
Mm-hmm.
coping that facilitates coping, and also even if it's giving themselves permission that I'm not coping so good today. So
Absolutely.
sometimes that's healthy as well when you acknowledge that it's just not going well today. So we want to talk a little bit more about that. So Tammy, tell me your perspective about stress and caregivers and some of the
Um,
things that they can do.
of course, we know that stress is different for different individuals. I really, even as you said, Elisa, I'd love to extend grace to the caregiver, and so that they can extend it to themselves. There are situations where it's just a husband and wife, and either one of them realize that I'm not cut out for this. I'm afraid that I'm going to do something wrong. So don't be afraid to reach out for assistance, because there are resources available. But I believe in this. One of the stress mitigators are two things: uh, preparation and schedules, routines. Okay, because when you establish that, you can almost anticipate what needs to have happen next. This also puts you in a position to be able to think about what this means, how it's going to go down, what it means to a person like you. Are you ready for this? Because there are so many other decisions that need to be made. For example, if I'm coming off of a job to take care of my parent, or if I'm coming off of a job to take care of my kid who's debilitated for an extended period of time, those are things that you have to put in place. um, the routine of it is that it kind of gives you a cadence on how to walk through and with those things. And if you have the almost the luxury of having someone relieve you, the patient will be used to the routine and will fall in line with the person who is the one that's going to relieve you while you take a break, for you to get your head together, regroup, see what's going on, and come back to be able to be the effective caregiver. Even on the airplane, put the oxygen mask on yourself first before you help anyone else. So
Exactly.
you really have to take care of you.
Exactly, and that's one of the things that when we're dealing with the perspective,
Mm-hmm.
and the approaches is
Mm-hmm.
just the fact that we need to. It's great if we can get the information and insight on the
Mm-hmm.
how tos ahead of time before we even take on that task or that role.
Mm-hmm.
But I think it's also important to stay agile, stay fluid, stay
Mm-hmm.
flexible.
Absolutely.
You have to know when to pivot. We build our schedules and our cadence, and
Mm-hmm.
life happens, and
Yep.
something will upset the apple cart. And guess what? We don't want to embrace that stress to the point that is not healthy for the caregiver,
Mm-hmm.
and then you displace it, and um, you know you're now irritable and cranky, a oompa loompa with
Yes.
the person you're taking care of. You're oompa loompa and cranky with the persons or people in your household or your
Mm-hmm.
family. Or how about this, we wind up giving our um, resources. It could be the social worker, it could be a care
Mm-hmm.
case manager that's supposed to help us, but we're giving them the blues. We want to displace our anger. Well, we have other resources and tools when those things occur, and you want to practice learning how to plug into those tools and
Mm-hmm.
resources. If it is that phone call to the family member, if it is that phone call to a clinical psychologist or the social worker.
Absolutely.
But start rehearsing it, start embracing the behavior that is not related to maladaptive stress.
Mm-hmm.
Stress that will now make you sick and you're the caregiver.
Mm-hmm.
It's what nurses have to do all the time. And I mean, we got case examples of those nurses during the period of COVID who were on the front line at the very beginning, the nurses
Mm-hmm.
and healthcare providers and professionals that were on the front line during when they were the epicenter, or
Mm-hmm.
um, just totally in the throes of it. And out of that came some great behaviors, but also out of it was some not so great behaviors. And we have to kind of embrace those things so that we can learn from it and
Mm-hmm.
be able to flourish after that. So, Tammy, what were some of the things that you experienced that you used as tools to make life better for yourself?
Um, One of the big deals for me was about 8 years ago, maybe 8.5 years ago. I left a job to come home and take care of my father. Can you still hear me?
Yeah, you're back. Thank you.
I left a job to be able to come home and take care of my father. And that for me was such a big deal because I was active in nursing. I wasn't at the bedside, I was working in a different setting. But at some point in it, I had to realize that I'm a caregiver. I am trained to be a caregiver, but it was so different because now it's my dad. Now it's something that's right near and dear to my heart.
It
But
hits
one of the
different.
things that was was a big deal for me is that even though I was a nurse, even though I was familiar with the disease and its process, even when we made the decision to bring my father home on hospice, that was a big deal because the hospice team was phenomenal. They provided services that I felt like I could do, and they had to tell me, sit back and be daughter,
Yeah,
which was
absolutely.
difficult for me because I mean, Elisa, you know that when you're the nurse in the family, all of a sudden you are the go to, or as you say, the epicenter of everybody. I
Yes.
stubbed my toe last Thursday night, and so what do you think I should do? Should I go to the doctor? Should I just wrap it myself? And so those kind of things. But when you learn what is available to you, that relieved so much of my stress. I had some help with my father because physically I wasn't able to do completely everything that my father needed. It's vital to employ help as much as possible
Let's say that
because
again.
that
Employ some
helps you
help.
from getting burned out. I was looking at this group that I'm a member of, the Black Nurses Rock, and one of the nurses put up there that she says she feels depleted and defeated, that COVID gave them something that they didn't sign up for.
Right.
So if you can
Yeah, I
go
get it.
into it with your eyes wide open as much as possible, that you know what the job is and what's expected of you, when you know the expectation, then you can weigh whether or not I can or cannot do this thing.
Right.
So what do you think, Elisa?
Well, I agree with you. I think that that is a great approach. We do have to stop and evaluate where we are. It's probably a good practice to take a step back and say, you know what? I've been doing this for a minute and it's been so many variables, so many nuances. There are times when, oh my gosh, this was straight overwhelming. And it seems to be reoccurring. I think I need to take a step back and say, did I really want to sign up for this? Am I prepared for it? Is there anything else? How about this? I've contacted everyone. I've used resources and tools, and it's still not a good fit. Guess what? That's okay. That's the time when we really do need to say, well, maybe there are other options and we need to explore that. And guess what? That's okay. We're not here always to do some of the things that man says we should do, tradition says we are to do. Even as a nurse, one of my family experiences was when my son was a toddler and he sustained an injury. I literally had a meltdown. I mean, I I had a meltdown with the pediatrician on the phone. And he said, "But you're a nurse." I said, "No, I'm a mom first." So,
Absolutely.
yes, we wind up shifting gears and changing those roles based on the
Mm-hmm.
circumstances. And when that occurs, we have to say, "You know what? I'm going to acknowledge the fact that I'm not real good being a
Mm-hmm.
nurse for my
Mm-hmm.
family, although my family has done that. I'm still sending invoices. I'm still sending the bills out, for all of those pearls and wisdoms. But you know what? As a nurse, and for all of our those in the audience who are healthcare practitioners, please, please, please be sure you stay within your scope of
Mm-hmm.
practice. You know, don't dispense anything if you don't have a DEA license.
Woo!
If it don't say OTC, over the counter,
Right.
don't be giving nothing out.
Exactly.
And make sure the same thing you do with your family, you're doing that you do with patients, you would
Mm-hmm.
do with your
With your
family.
family.
Consult the physician.
Mm-hmm.
And the same, we want to say that for the caregivers. That's another way of having your stress
Mm-hmm.
addressed. Um, Getting the basics done. You're checking your blood pressure, checking your attitude, noticing those subtle differences. Learn yourself. One of the things that we make sure, or the phrase is, know when to fold them, you know.
Woo!
And guess what? That's okay too. If it's
Yes.
way above your pay grade, it's too much, it's out of your scope,
Mm-hmm.
you signed up for it, but you didn't realize that it entailed or that much work, energy, coordination.
Mm-hmm.
Tammy, you mentioned about scheduling, getting that cadence, getting that rhythm, and that rhythm doesn't really fit your rhythm. Hey, that's one of I share this story with a lot of folks. When I did home care, um, prior to that, I was at Johns Hopkins as a nurse, and I was so, into it. My patients get discharged and they're doing great, and
Mm-hmm.
this, that, and the other. And then a week, 2 weeks, maybe 4 weeks later, they're back. They're readmitted. What's going
Right.
on? And only to realize that, wait a minute. After I started doing home care, I realized that I'm teaching them how to take care of themselves the way we do in the hospital setting.
Right.
When I got home, I found out it's a whole lot of other things going on that prevents them from taking it at 2 o'clock, taking their meds at
Mm-hmm.
2 o'clock. They're not even home yet. Or how about they needed someone to give them their meds at two
Mm-hmm.
o'clock and they're not home? They're not home from work, they're not home from school, whatever the
Right.
situation is, it throws it off. Well, guess what? I should have or the physician, myself, we should have collaborated and set things up that fits for the home. And that's key. If you're providing care in the home, which is what,
Mhm.
the bulk of our audience should be um, attentive to, is the fact that you have to then modify some of these things that fits
Mhm.
your home, your lifestyle, and talking to the physician is the first place to go. If there's a care case worker or a care manager
Right.
that's partnered with you, talk to them about see what the options are as far as some variations on your process on caregiving, so that you're not stressing yourself because of the rigors of something being oh, you must do it this way. Let's
Wow.
find out if there's, if you have to give something every 8 hours, that doesn't mean that it's you know 6 to, the deal,
Mhm.
but it could be 12, 8. There's it
Right.
could be variations on the theme. So I wanted to share that. Tammy, what were you going to add?
Um, with uh, the giving care at home versus what happens in the hospital. Remember that in the hospital, we usually have unlimited resources, such as diapers, pads. Um, we have someone to come in and do the laundry. We have someone that comes in to bring the meals, and so sometimes I used to work in rehabilitation, and it was always a big deal that the person that was going to be with them at home attend a lot of the
Right.
therapy sessions so that they can almost mimic what the therapist has to do in getting them to eat, getting them to swallow properly, getting them to
Agree.
even walk or use their assistive devices in such a way that sometimes it can prepare them. And fortunately, where I was, we were a rehab hospital, so we had ample staff that could do home visits within a week before the patient went
Right.
home, so they
Good
could
point.
see the logistics of the house, see how it was set up. Do you need to make the living room the new bedroom for the individual so that the care that they're going to need can be? The other thing is pay attention to the one you're giving care to, because
Yes.
this is new to them. They're
Yes.
dependent
Their
now.
perspective, right.
Their perspective of what's going on so that they can cooperate with uh, what's going on so that they can buy into it and be a team member just like you, that we are in this thing together so we can get you squared away, so we can get you safe. The big deal, please consider safety at all times. Always have a plan of escape in the event of certain events that we can't even anticipate, including when I'm not doing good, when I'm not having that good day. Do I have someone that I can say, "Can you give me 4 hours to me? Can you just give me time to go outside and walk without a mask on? Can you
Right.
do that?" That's all about protecting yourself and trying to give the best care to the person that you're caring for. Um,
And that in itself helps the caregiver stay healthy.
yes.
It is also a stress. That's a tool that is will help you de-stress when you know that you've asked,
Hmm.
you've solicited for help. You're now able to implement it. You did have
Absolutely.
someone come to the home. Those of you all that haven't had someone come to your home, do that. Let someone else help you with the assessing of whether this is doable, viable, whether it works. You
Absolutely.
may have some structural challenges. I like that example of you may have to convert the living room into a bedroom.
Hmm.
Okay. So what does that mean? It may also mean that there's financial tools and resources to help
Absolutely.
get some of that adaptation done to your home, and you're not aware of it. You think you have to fund this by yourself, and there's
Hmm.
resources available for that.
Absolutely. And
So we do want to watch out for that.
one
Yeah.
of the things that please understand with the types of diseases that your person has. Just
Yeah.
about every disease has a support group. Just about every ailment,
Great
your
point.
cancer society, your diabetes society, your impaired vision and deafness, all of them have resources available. When we brought my father home, uh, my father was well known in his community, so he had people that were just champing at the bit to help my
Right.
father. And
That's
we had a
great.
gentleman come out and build a ramp for us so
That's
that we could
great.
get him safely in and out of the house. Now that was indeed huge. And some people were like, well, did it take all that? Yeah. Because even though we only had two steps to get into the house and then we were all on one level, those two steps could break our back. Trying to
Right.
bump him up those steps or bump him down those steps. Every disease process just about has a resource and they are willing to help financially. They might not put money in your hand, but
I
they
know.
might pay a provider to
That's
provide
right.
a service for you. There are metal ramps that can be rented
Right.
and tailored to your home or whatever. Make sure in rehab, if they're gonna have to climb steps, tell the therapist so the therapist can teach your person how to climb the steps.
Correct. That's right. Those are the now I hope everyone's, taking notes. If not, just be sure to replay this video as
Yes.
often as you can and come back with pen and paper so you can jot these tips and cues down. It's important that we impart these strategies so that you can stay healthy. You can make the journey, a pleasant one.
Mm-hmm.
There are always some trials or some
Mm-hmm.
rough patches, but that's also life. And I think if you keep that in the correct context, it's not anything that you'll necessarily get overwhelmed with. But if you do get overwhelmed,
Mm-hmm.
then at least find out what works for you.
Mm-hmm.
Do you have to go to a paint and sip? They're virtual now.
Mm-hmm.
Do you,
Yep.
like Tammy mentioned, do you need just a minute to be able to walk outside and without a mask so you can get some fresh air? Do you need to just sit on the steps and watch the cars go by? If
Mm-hmm.
that's what you need to do, go do it. There's strategies. You might be able to take devices and have a monitor so that you can visually observe the person while you're out. You may want to consider something like that. Don't feel like a compulsion. If you
Uh-huh.
are feeling like a compulsion where I have to be here and I have to take care of them and I have to do this and I have
Mm-hmm.
to, as soon as you start feeling like that, guess what? You need help. You're going to need to pull back, or you're going to need to, you know, em- employ someone or use those resources that will fund or supply or, you know, staff those support systems um, and personnel. You have caregivers, you have
Mm-hmm.
social workers
Mm-hmm.
that are clinically licensed to
Mm-hmm.
um, know what these resources are or speak on your behalf. How about
Um,
that? We
one
want,
of the reasons,
go ahead.
excuse me, I'm sorry. One of the reasons why that's so important is because that presses that place of burnout a little bit further away.
Right,
And burnout is a very real emotion. Feel it, know it, and do whatever you need to do to try to steer clear of it if you can, if you
right.
possibly can. Burnout, you're no good to yourself or to that person. Take care of you. Keep your doctor's appointments.
Exactly.
Keep your therapist appointments.
And if you got to stand up and jump around, go jump around somewhere. Or if you got to have a old sitcom marathon on
Mm-hmm.
TV, go do that. But you got to find that thing that like makes you go, "Woosah," you know. And as soon as you find that thing or things, because
Mm-hmm.
it could be multiple for us, and we're not talking about doing anything that would impair your judgment, we definitely want to encourage,
Right.
you know, taking on behaviors and activities that
Mm-hmm.
actually promote health because that's what makes it sustainable. Do you need to take a one a day vitamin? I don't
Imagine
like
that.
I don't like the gummy ones. They suck. I don't like chewing them things. They but I will swallow my vitamins and I will drink my water.
Hmm.
So,
Yep.
so you want to stay hot. There you go. See everybody? This is what we do,
Hmm.
and we share all
Hmm.
these tips and cues. We not only share them with you, but we also practice it.
Right.
And so we're not going to live a life of a hypocrite. We literally are genuine and authentic. And we want you to learn how to be genuine and authentic in
Hmm.
that role as a caregiver.
Hmm.
It's okay to share. If you got that great neighbor that will say, "Oh,
Yep.
sure, I'll sit downstairs for a second while you run to the store,"
Hmm.
or there's a lot of resources that will help do your shopping for you. So you want to start thinking outside of the box as far as what you can bring
Absolutely.
into that whole process. So I know. I didn't know if we had any questions at this point.
Hmm.
I want to reemphasize that November is National Caregiver Month, and that one of the tools and resources will be that I would like for people to check out, and at least it'll get the thought realm stimulated as far
Hmm.
as looking
Hmm.
and researching for resources. Is the caregiveraction.org. Um, there is the website, but the organization is called Caregiver Action Network. Their number, I'm going to say it now, but we'll have a banner up for you. Is 855-227-3640. But the main reason why I'm suggesting this well laid out is easy to read, but most importantly, it will stimulate the thought about what tools you may need to employ in for your role and for the person you're caring for. Tammy mentioned earlier about every disease process pretty much does have an
Hmm.
organization that knows the ins and outs, may share those extra tips or just be that support for you. And
Hmm.
that's real important right now that we understand and start linking in. Everybody link in.
Hmm.
We want to understand that, know when to fold them, know that you're not alone, increase your tools and resources,
Hmm.
and take care of yourself.
Hmm.
Um, One of the things that Tammy, did you have anything else to share? I have a list of 10 things that I just wanted to share with our audience.
One of the important things that does help, and this comes under the knowledge is power kind of thing. Know what the expectation as far as the disease is concerned, the prognosis. Know where that is. Not that you're counting down the days until
Yeah,
this is no longer a part of you, but when you begin to see changes, begin to acclimate yourself. It's like um, a baby. You learn how to do the airplanes to get them to eat, and you
right.
learn how to cut the food in different kind of shapes that it makes it fun for them. But also remember who the person was before this illness.
Exactly.
If they liked it
Exactly.
before, they might still like it now. If they like to watch Jeopardy, you know, that kind of stuff. But remember that they were a person before this thing happened. And just because now they are dependent and they need your care, do not minimize who they are. Don't minimize
Exactly.
who they were. Sometimes it's tough when you've got individuals that are used to being in control, used to being
Right.
in charge, used to handling a lot of weight of responsibility, and now all of a sudden it's just you and them.
Right.
And so that helps you understand where they're coming from, etc. And those are the kind of things that kind of stabilize you to remember they're still a person. I still know this person.
Right.
And depending upon what you're actually dealing with, please, like I said earlier, give yourself the grace to learn this. Give yourself, honey, Lord have mercy.
Yeah.
Lisa, when you say be fluid, you don't know how vital
That
that
is.
really is to be fluid.
Right.
Okay, that's my 2 cents right there.
Very good with the 2 cents. If we're gonna, your cost of living is probably worth 4 cents, 6 cents by now. Because everything that we share is valuable.
Mhm,
You got to learn how to see the value in those services and tools and resources. But guess what? You got to see the value in yourself.
mm,
Let's go into more of life with eyes wide open.
mhm,
And you know I like that part, that alludes to expectations,
mhm,
knowing the prognosis. You eventually, we talk, some folks know about the stages of grief and loss,
mhm.
and that person we knew that raised us or
Right.
cared for us or was in our life, well, okay, they're not quite the same anymore. Now we're taking care of them.
Right.
Guess what? We need to just put the expectation right there, so that you don't start giving or have a root of bitterness, and you're
Mhm.
not getting into resentment and certain mental, behavioral
Yes.
thought processes
Mhm.
that's counterproductive, counterintuitive, ain't going to help you. Bottom line, it's not going to help you. And if you find that you're struggling, that
Mhm.
is your tip and cue to seek help for yourself.
Mhm.
And so, this whole conference will have the additional links and contact and who to contact and who to get in touch with, so that you have those opportunities to make your situation better
Mhm.
and keep yourself healthy. And that's important.
Alisa, I would also like to say, congratulations to the caregivers, because
Yes,
this is an
absolutely.
awesome experience for you. Thank you, thank you, thank you for stepping up to the plate. Sometimes it is thrust upon you. I
Yeah, it is.
understand. But even still, you didn't back away. You didn't
Right.
say no. You so I applaud you for
Yes.
this awesome undertaking. This will probably never happen to you again. Probably never. But um if if there's such a thing, enjoy the ride, enjoy it, because you get to know your person. Remember, you're still making memories.
Right.
I can still see my dad now pushing everything on the kitchen table off the kitchen table onto the floor because I wasn't coming to talk to him fast enough.
Yeah. Yeah.
But when it was time for him to bathe, he says his shoulders were frozen, so he couldn't move his arm. But he pushed all the stuff off of the kitchen
Right.
table.
Right. 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 Okay, sir.
Thank you, but congratulations to caregivers. Thank you for loving. Thank you for giving of yourself from this type of pour, because this is a whole different ball of wax.
I agree, and I too join you in commending
Mm-hmm.
caregivers. I have to evaluate myself often,
Mm-hmm.
because it's easy for me to think, oh, I'm a nurse, so this is something I'm supposed to do for
Totally
my
different.
family or loved one.
Right.
And honestly, when I leave work, I kind of take all of that off, and I have to be okay
Right.
with the fact that I take that off. So
Ooh.
therefore, I don't really have the expectation that I'm going to go home and take care of someone. Um, I had the opportunity to be the nurse for my nephew. Praise God, he's still with us 30 years later, but he's totally
Thank you,
dependent.
Jesus.
But I'll never forget when I did hit that wall and I said, I want to be his aunt.
I just want to be his aunt
I
again.
just want to be his aunt,
Right.
and there was no harm, no foul or anything, but it was that self recognition, that self
Yes.
identification that made me stop, just stop, because
Mm-hmm.
I'm constantly shifting gears and flipping. And to those in the audience, all of you all aren't meant to be caregivers. All of you all
Yes.
aren't meant to be a nurse or in healthcare.
Mm-hmm.
You all, most have careers that so not as intimate in taking care of folks
Mm-hmm.
as this profession. So I hope that, by just sharing some of a lot of this insight
Mm-hmm.
will strengthen your role and strengthen your process. I'm going to share these real quick. I think it's a good little list for caregivers. Seek support from other caregivers. You are
Mm-hmm.
not alone. Take care of your own health so that you can be strong enough to take care of your loved one.
Mm-hmm.
Accept offers of help. Please, please, please accept the offers of help. I do it at work. You came
Mm-hmm.
alongside to help me turn this person or whatever.
Mm-hmm.
Thank you. I take it. Accept offers of help and suggest specific things people can do to help you. That's important because if there are things that you got set and you know that the loved one will only accept it, whatever the care
Mm-hmm.
is, activity is from you, then keep that and
Right.
hand off something else. I thought that was a really good one.
Mm-hmm.
Learn how to communicate effectively with doctors. Tammy, you mentioned that about being that go-to person where you can emphasize what the needs are, translate. You are
Mm-hmm.
definitely, bilingual. You can speak human and speak
Indeed.
medical. So,
Alisa, can I interject? Right. One of the things that I've seen another caregiver do, she has a huge binder of stuff,
right,
and she has every doctor's appointment. She has the imaging results. She has all of these things that are just that she can hand it off to someone else for in the event that she has to make a different decision.
right,
But when that empowered her to be able to say, I know my person. And on this date, they had A, B, C, and D done, or they presented this, and this is what we did, and this is how it worked. It's okay to keep kind of a diary, almost not policing yourself, but just to see how things work. What did work on Thursdays might not work on Mondays and Tuesdays.
right.
So
Exactly.
those kind of things. Okay, go ahead. Thank you.
That's great. That's great. That's great information. And because we need to think about these things
Mm-hmm.
and start um, figuring out what we need to integrate into the process. Caregiving is hard work. So take respite breaks often. If you don't know what the word respite, RESPITE,
Mm-hmm.
it means take a nap, take a vacay,
Right.
take that walk outside, go sit on the step, watch the car.
Yep.
But if you can also, go out to eat and have someone, you might even be able to structure it where whoever the person that you're taking care of, they may not need 24-hour awake
Mm-hmm.
caregiving at the bedside or
Right.
chair side or wherever they're located with you there, and they have the capability to push a button or what have you. And you may want to look at those strategies so that you can step outside, step away.
Mm-hmm. Elisa,
Um,
one
mhm,
more little, excuse me. I remember raising children, and I learned to sleep when my baby slept.
exactly, exactly. And that
Now,
I'm telling you, it works like a charm. I have now learned how to take naps. I'm
mhm,
good with it now. So I agree with you about that process. Watch out for signs of depression and don't delay getting professional help when you need it. Dr. Mike talked about those signs earlier. We have a few more folks that will, in other sessions, that will emphasize those signs of depression or, feeling overwhelmed and what you can do about it, how to recognize it, and then what
mhm,
to do about it, who to get in touch with. You definitely want to get professional help.
mhm,
Be open to new technologies. That is my thing that can help you
mhm.
care for your loved one.
Yep.
That point right there about the binder with all the information,
Mhm.
the imaging results, documentation, et cetera, they have digital. Right
They
now,
sure
just
do.
think about this. This is what I did with my mom. I set up, and she's definitely tech savvy because she can text faster than me. But the thing I did do was, just convince her and a couple other folks to allow me access to their medical records. My
Very
daughter,
good.
same situation. So now we have technology where your medical information is now accessible online. You want to start building that muscle, and the main reason why is because of maneuverability. If you wind up having to take your loved one to and a different doctor, specialist, the hospital, whatever, there's information that you could probably share just because you can pull that up.
Hmm.
So now that binder with all that information is now digital.
Hmm.
Start teaching yourself that. And if your loved one that you're taking care of is higher functioning and at that level, do teach them as well. Make it as basic, but we need to bring, the so-called seniors, the so-called elderly
Absolutely.
folks. I think that's just a mind game. I don't think it's anything else. You can be
Okay.
as
Alisa,
old or young.
I'm sorry.
I'm sorry.
I need to go,
Oh,
but
okay. Yeah,
this
we
has
are.
been such a pleasure to do that. I hope and pray that you feel stronger because you have watched this. Alisa, the things that you're listing, to some people it might seem basic, but sometimes you have to remember common sense isn't always common. This isn't
Right.
to cut someone, but it's just to have someone say it in a way you can learn it is really a big deal.
It is a big
Okay,
deal.
gather your information, but make sure you understand what is being presented so you can move forward. Lydia, thank you very much for the opportunity. Alisa, always a pleasure. I love you all. God bless to every one of your caregivers. Bye bye now.
Okay. Bye.
Bye.
Okay, everyone. I'm finishing up this session, and thank you, Tammy, for joining us and sharing your insight and experience. Definitely thank you for being a blessing to those you have already taken care of and those that you will continue to take care of. But I want to just quickly finish up this list, and then I'm going to hand this back over to Lydia. So the last thing that I mentioned was watch out for signs of depression and don't delay in getting professional help when you need it. Be open to new technologies that can help you care for your loved one. So definitely live in the 21st century, people. Okay. Get, there's plenty of folks that can give you guidance and insight, but don't run away from it. Technology is here and it can be as supportive as another human being. It's hard to digest that sometimes, but I think that there are many times when we really don't have enough. We have the rural areas of the U.S. that they don't have a lot of folks signing up to be um, a home health aide or a caregiver. It's just not happening, and so with that known, then you have to build in these other tools and resources so that you're being empowered, strengthened, undergirded, supported in the best situation or scenario that you can be in. Organize medical information so it's up to date and easy to find. That goes back to technology. Your all the physicians or hospitals that have patient portals, start researching that. Get access and log in. Make sure if there's any legal um, components to having access to medical information, that's addressed in your state. As far as whatever the jurisdiction and regulatory guidelines are, you want to do that. And of course, again, you know, stay in touch with the primary care physician, your uh, case management worker, social workers, clinical workers. Make sure that you stay in touch with them so that they can assist you with, forms or anything that is not a known factor or common knowledge for your state. Make sure, and again, here you are, make sure legal documents are in order. If you need power of attorney, medical power of attorney, you want to do a lot of that on the front end. Love on your loved ones and help them understand what things they're able to suggest or recommend, or why they should pursue having you as the person on record. That's very important. And then give yourself credit for doing the best you can in one of the toughest jobs there is. It is the toughest. You know, there are many of you all who are caregivers and you're not getting paid. And so you have to understand where your reward really is. That's why Tammy and I, applauded you all for being caregivers in the home. There are some caregivers that are family members that go back to school, know that, hey, if I become a home health aide or a nursing assistant, um, or get some other type of credentials, if you call the Department of Aging in your state or local area, they can give you tips on cues on programs that you can sign up for as far as being a companion, a caregiver, and then be the same person who gets paid for doing that for your loved one. A lot of folks aren't able to sustain employment or viable employment that covers all your expenditures and things like that, and have utilized that as a resource and um, or opportunity to generate revenue so that they can you and your care and your loved one can have a place to live and be healthy as far as meals. Understand those churches who provide services, Meals on Wheels. There's organizations all over that. How about this? You can buy food, you can cook, but something changed and now it's gotten too hectic. It's okay to ask for Meals on Wheels, to have food delivered so that that lifts the load a little bit. Um, it's okay to see if someone will come in, even if it's every 3 months. Can you come in and just do the laundry or help me do laundry or help me clean? Just don't try to do it all by yourself. It's really important that you stay healthy mentally, physically, and definitely spiritually. I want to say thanks to Lydia for having this session. We're getting close to the end. I hope that the information we shared was enlightening, supportive, empowering, and just a big old blessing. Lydia, I think you might have to refresh. I'm not hearing you. But as you all can see, we have the banner at the bottom of the screen, Caregiver Action Network. We want to give them a shout out. It's a very well organized website, but most importantly, um, they will be able to give you other additional ideas and tips and cues. I just want to make sure that there was something that we provided that's very tangible to our audience. I think Lydia's still in freeze mode. So anyway, I'm not sure if any questions have popped up. Hopefully, it has. You have questions. We can start taking a look at those. I want to give Margaret Henry a shout out. She said, "Thank you for this information," and we actually appreciate that too. We like to know that what we're doing is, helpful, beneficial to those that are in need or in this role. The objective, again, is to give information and insight on how to reduce the stress of the caregiver. Um, we're now getting in telehealth. I want to give telehealth a shout out. um, I've been doing this for a long time, and I'm so happy about telehealth because, that commute to the doctor's office is now eliminated. That round trip that adds time to respite, time to laundry, maybe time to doing a meal, or time to see that extra movie, that TV show, or just some quality time with the person you're taking care of, where you don't have to tussle and wrestle them to go to the doctor's visit. You don't have to address the um, access issue, whether it's the accessibility. So that's kind of cool. I think that's something I would love for folks to embrace even more. Just make sure that everything is compliant with privacy. Don't just sign up with any telehealth organization. That was something that would be, um, you know, you need to have it vetted. And of course, you'll have your caregivers that will help with that process. I mean, your support system. The healthcare professionals can help you discern which organizations or entities or agencies are appropriate telehealth organizations. I do see the question: do you think telehealth visit is as effective as the in-person visit? Um, I love that question. I am that person, even on the administrative side, I will pull out a stethoscope. But to the point, one of the tips was learn how to communicate with the doctor. You know what? It's also important for the healthcare professionals to know the right questions, how to ask that question so that who they're speaking to understands. So if you do know how to ask that question that's relevant. Earlier I mentioned about how healthcare became more relevant once I started doing home care. Once I understood the rhythm of the home, what the challenges were in the home, then the care, the treatment had to then be can be adapted to their home, their lifestyle, um, their workflow, their school flow, whatever was going on in that home. And this telehealth has to embrace that as well. When they really start paying attention as to how things go in the home, and that's going to be a tip and cue. If they're saying, well, this is a common practice, this is what you should do, and you want to be able to ask the question, is this a common practice in the office? Is this a common practice in an urgent care center? Is this a practice in a rehab center, a hospital? And if you ask that question and they say yes, that's not going to be uh, a well comprehensive telehealth visit. We may need to be in person. If the physician or nurse practitioner can't say to you, well, did you take their blood pressure? Did you take their glucose level? What time? What was it? What did they eat? If they don't go into that specificity and details, it may not be a good telehealth visit as it would be in person. And so right now, because this is a transition, I think everybody has to get comfortable with that. Oh, we didn't ask that question, but let's do it again. Telehealth should say, oh, or you, the caregiver, may say, they didn't ask me this and they didn't ask me that. And this is important because this is a change. Or this is and that change could be good or an improvement. And if they didn't do that, then you may want to say, we need to have an office visit in person because you do things in person that you're not doing on telehealth. And it'll either help them, empower them to do a better job via telehealth, or you may have to just continue doing in person. But minimally, you will have the leverage to not have so much time consumed with your commute, getting ready, sitting in the office, especially with COVID. Now we still have social distancing, still need to wear masks. Um, and if you are taking care of someone where you need an extra pair of hands to transfer them and transport them, that now gets uh, that now is no longer requiring extra energy and effort. So that gives you strength to take stress off of you. And I think that's when we need to start using things interchangeably in tandem. Well, I may not, this is too much going on. I'm not going to do a telehealth. Let's do it in person and vice versa. We just need to do an update, a follow up. They started a new med, they're doing good, a new dose, they're doing great. Um, we need to do the telehealth instead of in person, just so I can tell you they're doing great and why, and leave things as is, or if they say, the physician or the nurse practitioner will know. So, yeah, do I think telehealth visit is as effective? I just want to say that it can be, with all parties participating. Um, but there's that time when you got to go and pull out that stethoscope so the doctor can hear for themselves, unless you're a trained professional, that is also the caregiver in the for your loved one in the home. So I hope that kind of answers your question. Um, Lydia, are you back with us? I see you. Are you texting me? You want to nod your head? Oh, you're welcome, Miss Henry. Thank you for the question. I think that is important for 21st century. I'm kind of a tech geek anyway as a nurse. Every nurse has a side hustle. So technology and videography and all that good stuff. So um, those things are my therapy and my stress relievers as well. So thank you for that question. Okay. Not sure if we'll have a commercial or a promo. We will be heading into the next session, session three. Um, and I would have to play the video to know who our moderator is and who our guest speaker is for our mental health conference hosted by HDK Productions.
I think I'm here. Am I here?
Yes, I can hear you.
Oh, thank you so much, Lisa. We had an internet hiccup here.
Yeah, it happens. It's real.
Everything went down for a second. I'm so happy that you came on, and thank you for just keeping us alive while we
We're
were
live.
updating and getting everything back online. We are still here. You ladies, you and Lisa, I appreciate you so much for everything that you have done today. You are just rock stars. And the information that you have given today is priceless. Thank you so much. Um, Thank you for being that person for me always.
My pleasure.
You are always that person for me, as
And
you
you're
know.
welcome, Dr. Barnes.
And I appreciate you. And we will talk. We are starting to run behind about 2 minutes, and I am a stickler for time, as you know. So I'm going to hurry along, but we will talk soon. Again, thank you. Of course, next year I will give you a call again because I think you guys give such information on, caregiving and how to deal with that stress, and even tips on how to deal with just being a caregiver. That
Yeah.
information is priceless. So thank you. I
Thank you for having
appreciate you.
me.
I appreciate you.
All right.
My road dog, and we will talk very soon. We're gonna get into the next session in just 1 minute. The oh, there we go. Our next presenter is already here. She's waiting patiently, so patiently in the wings to come on and give us her words of wisdom. So, without further ado, let me, there's all these things that we do, as Lisa was talking about technology to move us forward here. So, let me introduce our next speaker, which is Miss LaDon Bridges. Hi.
Hi, everyone.
Hi. Can
Can everybody see and hear me pretty good?
I think we can both see and hear you.
Okay. Well, good. I was going to say good morning, but now we are officially afternoon. Good afternoon, everybody. It is a blessing. I'm so glad to be here. Thank you, Miss Lydia, for allowing me to speak. I appreciate it.
Oh,
Um,
can I say something for 1 second before you run
yes, you
into it?
can.
Guys, I have to tell you that Miss LaDawn here is probably one of the most special people I've met since I moved to North Carolina. Um, she is awesome, and I promise you that everything she tells you, you want to take notes because it is wisdom to live by. And with saying that, I am going to turn the floor over to Miss LaDawn Bridges at this time.
Thank you, Miss Lydia. So my topic today is best friends forever. And what that topic is specifically, I know it's a general topic, but it's really about self care, self love, and really some core belief systems that we develop over the years based off of experiences. Okay. So, one of the first things that I would like everyone to do, we're going to do a small icebreaker. Okay. If everybody, can you guys just raise your hand in the comments if you have access to look at yourself at this moment, like whether it's through your phone, through your computer, through a mirror? I need everybody to look in themselves. And when you have that ability, just kind of raise your hand if you have that option. So we're going to start now. Okay. The reason why I kind of wanted you to look at yourself is because I wanted you to realize that you are your own best friend. A lot of times, what we hear is, I've been busy for everybody else. I'm so busy being a mom. I'm so busy being a wife or a husband. I'm so busy being a partner that I don't have time for myself. I work full time, I go to school full time, that we very rarely carve out specific time for ourselves, right? So that's what the meaning of being your best friend forever is. So, one of the things that I want everybody to do is think back to your best friend. And when your best friend calls you, and it's like, yo, or girl, or man, whatever your best friend is, and think about the types of issues that your best friend may bring to you, which may be problems at home, problems at work, problems in them being able to gain momentum in the things that they want to do. What usually happens is we stand back and we encourage them. Oh, it's going to be all right. You're going to be fine. You got this. We tell them to remove things that have no value in their life, or we'll tell them to add things to enhance whatever goal that your best friend is telling you about. But we very rarely step back and take that same approach to ourselves. If you can tell your best friend, oh, that person is not no good, is not any good for you, or that situation is not any good for you. Our goal in therapy is to allow you to take a step back and do that for yourself. Because if you can't be your best friend, meaning if you can't give yourself the same advice that you give your best friend, there's a missing piece there. And one thing that I'm finding in being a therapist is that people are givers to their core, but they won't give to themselves. Okay, so let me give you a little background about who I am and how I became a therapist in general. Because I think this is important to know. So, I was one of those people. Like, I was one of those people not giving myself that time either, not giving myself that kind of self care and self love, right? So, Went to college fresh out of high school, got sick, dropped out because I got sick. I started having seizures. And so I went down years of floating in the wind. So, number one, I was disappointed in myself. Number two, I was depressed. Didn't know I was depressed, but I was a functional depressed person. Meaning, yes, I would get up, I would go to work, but that was about it. I didn't care about any self love or self care. I just did what I thought was supposed to do because I was a young mom and I needed to go to work, right? So, years of depression, functional depression, led to me not being my best friend. Okay. So I didn't go to school until later in life in my 30s, where I had 3 kids, a bad marriage, and it was more based off of I had to do something different, if that makes sense. And I know for some of you guys, you know when you have to do something different. Okay. So I was in that place. One of the things that I say to a lot of my clients is social work chose me because that was not my initial endeavor in school. Actually, I wanted to deal with criminal justice, but social work chose me because of the ethics and the values that was associated to being a social worker. A lot of social workers get a bad rap because when we think of social work, we think of social services, we think of child welfare, we think of the negative connotations of what a social worker looks like, right? But social workers, the difference between social workers, so I am licensed clinical social work. The difference with how we do therapy and how others may do therapy is because we're taught to look at the person in their environment, if that makes sense. So if you are a person who is motivated and you know the type of person that's going to get it done, but you're in an environment of toxicity, we look at, okay, yeah, you're motivated, yeah, you want to do all these things, but your environment is not conducive to your goals. Okay, so we look at the entire environment and we say, you have to self love and self care enough to know that if this environment is not conducive, what are the steps that we can do to change that environment? Right? Now, here's the catchy part of that. Most of us will tell our best friends that, girl, you need to get up out of there. Or, yeah, man, it's time for you to go. But we won't do ourselves that way. Okay. So, what I want you guys to do is realize, on this platform, that one of the goals that I want you to do this week is to say, am I being my own best friend? I want you to be able to pick up your phone or pick up a mirror and look at it and saying, what, if you're in a space, what would I tell my best friend at this moment? What would I tell my best friend in this moment if they were telling me the things that I'm telling them? Okay. So the next thing I want you to do is share some grounding techniques and stabilization techniques, right? This is part of being your own best friend because in a moment that we feel uncontrollable, whether it's through our emotions or in our environment, we need to learn some things that we can do at the drop of the dime to self contain ourselves. It's called stabilization. Another word for stabilization is grounding. Okay. And these are things that you can do in your bathroom, in your whatever it is, at work. You can do them at work. You can do them at church. You can do them anywhere. Ground yourself. Okay. So, one of the things about grounding yourself is it allows you to not allow your emotions to take control. Okay, I'm gonna go back to your best friend. If your best friend is out of control, one of the things that we say, calm down, sis, or calm down, bro. I need you to calm down. Why? Because when you're calm, you can think. When we allow our emotions to run rampant, that's usually where most of our mistakes are made, when our emotions are in control. The grounding allows you to regain control of your emotions. Okay? So, the first grounding technique, and which seems simple but it is effective, is called acupressure breathing. Okay? So here's how acupressure breathing works. You locate, there's a muscle that's between your thumb and your index finger. And this is a good technique because you can grab your hand up under a table or anywhere and do this technique. You grab your hand, you put the muscle in, you locate that muscle in between your thumb and your index finger, and you massage it. You firmly and slowly massage it. Okay? And then you find a rhythm. A rhythm can be a song, a rhythm can be your counting, just a rhythm. And you just calm yourself down through acupressure breathing. Okay? This is something that's very effective, especially um, when you have to ground yourself quietly without anyone knowing. Grabbing your hand and just massaging that muscle. It keeps you grounded. Okay. The second technique, which is very underrated, is called belly breathing. Now, belly breathing is totally different than the automatic breaths that we take every day. Belly breathing is intentional breathing. Okay. So you can sit, you can stand, you can lay down with belly breathing. But again, this grounding technique allows you to regain control over emotions when you know you're out of your your usual pattern. Okay? So you place one hand on your upper chest. Again, this is called belly breathing. Okay? And you place the other hand on your diaphragm. Okay? You breathe in slowly through your stomach. So I want you guys, if you're on here, to try this. Breathe in through your stomach, letting it blow up like a balloon. And then you want your chest. So when I'm doing it, my chest is remain still. Okay? And then you breathe out slowly through your mouth. So I'm gonna try it. I'm gonna do it 3 times, okay? So now this technique, I hope you guys tried it. This technique is wonderful when we are in our quiet space. Um, I'm gonna talk about me, and I don't know about you guys, but I'm gonna talk about me. When I have had a bad day, and we all have them, there are times when I need to go into my prayer place, whether that's my room, whether that's the bathroom, and I have to ground myself. Belly breathing for me is what does it for me. Because why? I'm thinking about the oxygen that I'm inhaling and the crap of life that I'm exhaling. Okay? So that I can get my thinking patterns out of my feelings. Because what happens is when we are in our feelings, we allow negative automatic thoughts to take control. Now, what are some of those negative automatic thoughts? See, I shouldn't have did that. I shouldn't have said that. I shouldn't have did this. I'm so dumb. I shouldn't have. Negative automatic thoughts that we've been practicing for years. When we start to ground ourselves everything after the grounding becomes intentional. So, yes, the situation has not changed at all, but now I'm thinking differently because my negative automatic thought pattern has not taken control. If that makes sense to you guys. Okay? So, grounding yourself can be as easy as counting the colors in your room. So, if you guys look around in your room, I want you to start counting how many colors you see. When you're in a tough situation or a heated argument, start counting the colors and watch yourself calm down. Because it's all about protecting yourself. Again, being your own best friend, being able to manage yourself differently. Because what usually happens, you guys, is we expect outside stimulation to manage our inside turmoil. Again, I'm going to say it again. We expect our outside to manage our inside. Doesn't work like that. Because why? We can't control other people. We can't control what's on the outside. But we surely can ground ourselves and center ourselves to where when we are receiving this information, we are not getting enthralled in the emotions. Okay? Again, being your own best friend, telling yourself what you would tell your best friend in that moment. Okay? So if you guys have any questions about any of these things, please put them in the comments. Um, that would be great. Now, I'm going to tackle something else, y'all. In being your own best friend, a lot of us has been taught, this is a learned behavior, that we are not so important. Okay. Uh, Mainly because, especially if you're the oldest child, if you are the oldest child, you may have a feeling of tired of being responsible for everything. Like you had to take care of your siblings, or you had to take care of things your siblings may not have had to take care of, right? So you have this negative thought pattern, possibly, that I'm responsible for every doggone thing. I'm tired of taking care of people, right? Not realizing that the power to change that dialogue you having with yourself comes from grounding yourself and saying, okay, yes, I have been responsible for everything. And yes, I have a responsibility that maybe others in my family may not have had. But now I get to choose. Now, today in 2021, I get to say, yeah, I am the responsible one. But I recognize my appropriate responsibility. I don't have to take care of everybody like I used to. And being that person also challenges you to put up healthy boundaries. And that is very difficult for a lot of us. For a lot of us, it's very difficult to put up healthy boundaries with our parents. We were talking about the caregivers. And my mom is a caregiver, so I'm very familiar with uh, the emotional toll that can have. Okay, but how do we tie caregiving and being your own best friend? Boundaries, healthy boundaries. Okay, let me give you a simple example that a healthy boundary can be: learning how to say no in different ways. A lot of us do not have the ability to tell someone no. Okay. What I teach in my therapy is I want you to come up with 5 different ways you can say no without saying no. Okay. So that you can be ready for the no. Now here's a couple of them. Let me get back with you on that. Okay, that's one. Let me think about it for a minute. I don't know. That don't sit right with me right now. Let me think about it. Okay. 3. I already scheduled a self care session. I'm not doing anything at that time. Maybe another time. Okay. 4. Uh, and this one is a little bit more direct, so you might not want to say it to your parents, but you can say it to other people. Um, it's just simply saying, eh, eh, because people pick up on body language, right? So usually when you come with a or a shriek or something, that is telling them I'm not comfortable with that yet. And most people will say, well, they'll come up with an alternative in asking you. Okay. And the 5th one is simply saying, I'm really learning how to say no. And it's hard for me to say no, but I'm learning how to say no. So I'm not saying no, but I'm trying to learn how to say no. And the average person will pick up on that hint. So I want you guys to come up with 5 different ways that you can say no without saying no if you have an issue with saying no. Okay. Another thing that people have an issue with boundaries is hierarchy, meaning parents, aunties, uncles, grandparents. We usually follow whatever it is they tell us to do because they're in a hierarchy of being our elder, right? If you were your best friend and your best friend called you and said, my Aunt Sue, then word the mess out of me. My Aunt Sue called me over and over again to have me do this, to have me do that, to have me do this. What would you tell your best friend? The average person would tell their best friend, but girl or bro, you better tell Aunt Sue, you can't do it this time. If you can tell your best friend that, you got to be able to tell yourself that, if that makes sense, okay? Do not let the fact that it's again about healthy boundaries, self care, don't put others' needs ahead of your own. If you are in a season in your life that you know that you don't have a lot to give, why keep offering it up? Some of us are already on E, but we still offer some of our gas. That's not self love. Self love is saying, I'm on E and I need some fuel and I really don't have anything to offer right now. I really don't have a lot to offer. Okay? And being comfortable and loving yourself enough to say, I don't have it to give right now, Aunt Sue. And I can't do it right now. Again, what ties in with the no. Don't let because this is your elder tell you that, okay, you won't eat, but I need this. I'm sorry. I don't have it to give. Being your own best friend. Okay? Healthy boundaries. A lot of us never learned that we had an option to say no while we were growing up. If you grew up in an authoritarian type parenting style where your parents told you what to do and didn't give you a lot of options, um, you tend to look for that type of relationship with friendships, with work, with civic organizations, even in church. When you are raised by an authoritative parent, it's a hard job to say no and to give those healthy boundaries because you were just taught how to follow instructions. Okay. But with that, on the flip side of that, also comes that you never learn to trust your own self. You never learn to trust your own decision making because why? You've been following the rules. Okay. You ever wonder why some people can go to hard jobs and flourish, and some people can be at that same job and get irritated, right? It is a difference of experiences. If you have a micromanaging type boss or supervisor, 9 times out of 10, you're familiar with that spirit somewhere from your past, whether it's through parenting or grandparenting, you're familiar so it doesn't bother you. But then you add in someone who grew up in more of a free flowing type parenting style that allows you to make your own decisions and flow like you want to. Having a micromanager feels like he's backing you in a corner. So you might not do well in that setting. Okay? Because again, when we are in certain environments, we bring all of our experiences with us. Okay? So if you came from a tell you what to do parent and you go to a tell you what to do manager, ain't no big deal for you. And on the flip side, it's free flowing, do what you want to do type parenting style, kind of giving you the choices, you know, and you add that person into that authoritative management style, ain't gonna work. It's just not gonna work. And what happens a lot of times is people don't realize they think it's the boss. That boss just get on my nerves. That supervisor just get on my nerves. No, you're not familiar with that type of style of management. Okay. So again, being your own best friend, knowing what type of background allows you to flourish. Okay. Me personally, I didn't have an authoritative parenting style. So when I went into authoritative uh, jobs that were a little bit more micromanaging, if that's a word. I know that's not a word, but I'm gonna make it a word today. Um, yeah, I could not flourish in that. Okay, so I had to learn how to, instead of trying to change my outside, I can't control these people's business. This their business, right? I can't control the way they manage. This is the way they manage. I had to go in. I had to go inside and say, okay, what about this position or what about this what about this job is triggering me? Because I'm not doing well and my girl over here doing fine and my homeboy over here doing fine, but it wasn't for me. Okay. So again, being your own best friend tells you to look within for the answers because you are your own best friend. You got to learn how, we all have to learn how to look at ourselves in the mirror and say, you look good, or you doing good, or good job, whatever it is that we would tell our best friend. Okay? So, healthy boundaries. is another thing that is the thing we have to learn. So now I'm going to touch on some adult core beliefs. Um, and what I'm going to do is I'm going to read the negative, and then I'm going to read the adaptive preferred type of reception to that negative saying. Okay. And I'm going to associate it with one of a couple of life lessons or a couple of life experiences, right? So the first one is I can't protect myself. That's being vulnerable. I can't protect myself. Um, a lot of people experience that negative core belief that they can't protect themselves if they've been abused, right? If they've been especially verbally abused, and physically, that you have a negative core belief that you can't protect yourself today. The adaptive belief, the preferred belief, and this is why uh, therapy and mental health is so important, is therapy allows you to get to understand that I can protect myself. I may not been able to protect myself then, okay? But I can protect myself today. And I can learn to protect myself today, okay? The second one is competency, okay? Now, the competency negative beliefs are I do bad things. I'm not good enough. I'm a failure. I should have done something, okay? You, as a human, are based on patterns. We all are. If we have had negative patterns in our lifestyles, right? Um, Especially a okay, this is a good one. A person that's always chastising you or that always chastised you as a child, okay? You could form that negative core competency belief that, dang, I don't never do nothing right. Oh, dang, um, I'm always messing stuff up, right? Mental health therapy allows us to believe the preferred competency belief or the adaptive competency belief that I can learn from my mistakes. I am good enough. Yeah, I made some mistakes, but I'm good enough though. I can learn to do right. And I did the best I could with the information that I had at that time. That's what mental health allows us to do. Okay, it's allow us to say, yes, that's what I believed back then, but I'm learning to do better today. Okay, the third one, the adult core belief, worthlessness and lovability. Okay, now negative. Let's deal with the negative. I'm unlovable. Oh, I'm unlovable. I'm worthless, and I'm inadequate. Now, this is how we think about this negative core belief in thinking. Failed relationships. Man, I can't get nothing right when it comes to relationships. I keep having these the same. I can't. Oh Lord, I keep the same type person in a different body. They keep leaving me. Why they keep leaving me? Maybe I don't have any value to them. Okay. Now we're gonna flip that thing. I'm okay just as I am. Okay. I am learning to accept myself, flaws and all, being perfectly imperfect and perfectly perfect. Learning that, you know what? Maybe that just won't my people. Maybe I was settling. Maybe, I was choosing the same person based off of my trauma. A lot of us, if you're like me, um, when we first started dating, pick people who were familiar to us. So if your uh, parent was a heavy drinker, you didn't mind dating a heavy drinker. If your parent was, a bit of a Rolling Stone, you didn't mind dating a Rolling Stone. You know why? Because that spirit was familiar. Okay, it was familiar, so you allow it. Okay, yeah, okay. She drinking 240s or whatever, but that's okay. My daddy drank like that, so I'm good with it. No, that's a part of um, not knowing that a drinker triggers you. Okay, mental health allows us to cross over and say, you know what, I'm good. I'm good on that because I'm better. Okay. A lot of us have not found our person and are single because we are not our best self. And for me, and I'm married and divorced, I just got to say that, but I rather find my person on the good side of things, not when I'm broken and unhealed. Because when you're broken and you're unhealed, guess what you attract? Brokenness and people that are unhealed. Okay. So instead of saying, why I ain't got my person yet? Be grateful that that person is on the other side of your healing. Okay? That you need to heal first before you allow a person into your life. Okay? Now, the fourth negative core belief, which I already touched on with being the oldest for a lot of us, is I'm responsible for every doggone thing. I'm just tired of being responsible for everything, man. Yeah. And again, that for a lot of the oldest children in a family, that is one of the reasons why usually the oldest usually branches off and does their own thing. If you think about a couple of your family members who are maybe the oldest in their family, they usually move away or do their own thing. You know why? Because they've been years, all of their life, being responsible for other people. And the only way they can find peace is to move away. Okay? Now, with therapy, again, or with dealing with your own mental health, you learn to say, I can have responsibility appropriately. Okay. The fifth adult core belief, okay, is control instinct. Oh, this is a big one. Oh, this is a big one, y'all. It really is. Here's the negative from control instinct. I should have done something. I wish. That's the if, coulda, shoulda, wouldas of it all. Okay. I have to be in control. If I'm not in control, I am not comfortable. Now I'm getting ready to say something that might offend some of y'all, but I gotta say this. You find this a lot of in civic organizations. The person, civic and religious organizations, I'll say that. The person that gotta run everything. They got to have control. If they don't have control, they it throws them off. Okay. Um, I'm powerless. I'm feeling powerless. I can't control. Okay, that's a part of control. I'm helpless. Okay, and I'm trapped. I'm trapped. I'm helpless. I'm powerless. I have to be in control and I should have done something. That is control instinct. Okay. Where do we learn that from? From my experiences, especially if we have been abused. Okay. I'm not going to touch on a lot of abuse because I can't cap it. So I'm just going to talk in general abuse. So general abuse being whether it's sexual, physical, mental, verbal, just abuse in general, especially if we experienced it at a young age. It alters our control instinct. Okay. Again, mental health, mental therapy, going through the process of healing crosses you over to, you know what? I did what I could. I did what I could. And I'm safe if I let go of some of that control. Matter of fact, it frees me a little bit if I let go of some of that control. Another safe, preferred belief in control could be I can recognize what I can and cannot control. Meaning, going back to what I was saying about that authoritative work environment you may be in, you can't control them people business because that's their business, but you can control self. And when you go to work and you can say, "Boo, y'all, y'all do what y'all want to at this job, cause baby, I'm good." Okay, that's a part of learning a preferred control instinct. Okay, we only can control ourselves. We cannot look for outside validation or outside stimuli or outside people to monitor and manage us. That's our responsibility. All right. Now, the last one I'm going to touch on for the adult core belief is survival. Survival instinct. Survival instinct. This is good for some of us. Okay. Survival instinct. I'm saying this one right here usually triggers a lot of people. Okay. Um, and again, I got to go back to the abuse. The abuse. And a lot of us don't realize that some of the abuse that we suffered as children was not willful, nor was it, what's the word, just at you. A lot of this is passed down generation to generation to generation. Being verbally berated is passed down generation to generation. If your mama cussed you out for no reason when you was 12, 13, probably because she got cussed out for no reason when she was 12 or 13. And before that, because what we forget sometimes, y'all, we ain't but a few generations, just a few. For me, my grandmother was born in 1910. So her parents were born right after slavery was over. So I'm only like 4 generations from slavery. So we got to realize, right, that we got to realize that a lot of this is generational stuff. Yes, Miss Shirley, it is our responsibility to control ourselves. It is. Thank you so much for that. But this last one, survival technique, I kind of want to preface that because a lot of times when we were cursed out as children or smacked or berated or touched inappropriately, we take it on as something that we did individually. And that's so not the truth. And that stops a lot of us dead in our tracks from going for what is in our core that God gave us. Okay? A lot of us, and I gotta say this, the enemy been after a lot of us for all our lives. Okay, so I'm gonna touch on this survival instinct, the negative beliefs. I'm discarded. Somebody just threw me away. Something wrong with me. I'm defective. Everybody always leaving me. I'm abandoned. I'm alone. I'm tired of being by myself, man. Why am I always by myself? You know what? I ain't gonna feel. Mm-mm. You ever heard somebody say, "What's wrong with you?" Nothing. And you can tell in their body language that there's something really wrong with them, but they don't want to talk about how they feel. They don't want to talk about feelings. I'm unimportant. I don't matter. My needs don't matter. And I'm invincible. Nobody sees me. That is the negative survival instinct that we have learned basically from our experiences. Again, with therapy and with taking care of your mental health, I promise you that you can get to the other side of the preferred adaptive survival instinct that I can survive. Doggone it, I did survive. I'm existing. I'm going to get my needs met. I'm going to speak up for myself. I'm okay as I am. I can begin to learn when and how to present myself and discuss my feelings. I have value, doggone it. I matter. And guess what? I can get my needs met. You know why? Because I'm my own best friend. So when you're not meeting my needs, I'm not coming at you trying to say, why you ain't talking to me? Why you ain't doing this for me? Why you not doing? No, baby. Let me get my needs met by discussing it with myself first, right? Discussing, okay, this person is leaving me feeling empty. Why? Why am I feeling empty? Why is this situation leaving me feeling empty? Right? And a lot of that is because we don't have the ability to communicate, right? What we're actually going through internally. Like Miss it is our responsibility to control ourselves, but it has to be learned. It has to it has to kind of be instilled differently. It's like we learning a whole new class on loving ourselves. Okay? Some of us growth was stunted before we even started to grow. So I challenge each and every one of you guys, start being your own best friend. Start looking in that mirror and say, you know what? If ain't nobody gonna rep for me, I'm sure gonna rep for me because I ain't got a whole bunch of representation, but I'm gonna start loving myself differently. Watch your world change. Watch your world change. Your world will change when you start holding yourself accountable for your happiness. A lot of us are looking for outside or looking for people to make us happy when they ain't happy themselves. They already on E. So how they gonna make you happy? They can't. Okay. So I just challenge everybody on this platform. You know, um, I use this analogy. Happiness goes up and down. You get a new car, you're happy. 2 months later, you're back to your blase feeling. You get a new job, you're happy. Hey, you're high, you're on the high. A couple months later, can't stand the job. You get a new boo, you're happy. You go on a trip, you're happy. When you deal with yourself and learn to be your own best friend, happiness is a byproduct of your joy. So if you can find the joy in being you, happiness can come and go and you still good. If that makes sense. Okay? So I just want to thank y'all. Open y'all. If you have any questions, I practice out of North Carolina, so I can just service North Carolina people. But if you have any questions, I do telehealth. Telehealth is just as effective, and it may be a little bit more effective for the work that I do because the person gets to pick their safe environment. See, if you coming into my space in my office, that's my environment. That's my safe space, right? But when we do telehealth, you choose your own safe environment, so it works better to me for my patient, my clients. Okay, so just know there are several platforms that you guys may be able to use. Check with your insurance because a lot of the insurances have online platforms for you guys to have some sessions. There is MD Live, there is Amwell, there is various other online platforms that usually insurances can offer you. I know I have a lot of uh, clients who hit me up with their EAP. Check your employee assistance programs. They usually give you 5 to 10 sessions free of charge. Make sure you show up for yourself, okay? Be your own best friend, you guys, because if you can rah rah for your best friend, you need to be able to rah rah for yourself, okay? And it's a work. It's not easy, okay? Yes. But thank you so much, Miss Yolanda. I appreciate that. Yes, happiness is a byproduct of joy, right? So, negative thinking. Yes, Miss Shirley. Yes, Miss Shirley. Okay. Happiness wavers. It does. It comes and goes. But some of us got to get some of all that old stuff out to realize that joy belongs to us. Okay. And that's what therapy aims to do. All right. Clean out all that gunk, all that mess that joy is kind of hidden up under, that won't even realize stuff. Okay. Especially when you've been dealing with abuse all of your life, verbal mainly. People telling you what you are and what you are not. Like they know. And they ain't even know themselves. So y'all, I encourage you guys to look into your own employee assistance programs, get with a counselor, and if you prefer a certain characteristic from a counselor, you can say that you might just want a man, you might just want a woman, you might want a person of color, you might want a person. Let me tell you about me. I'm kind of like the hoodish therapist. How I talk to my friends and my people I know, I talk to my clients the same way because I want them to know ain't no big U's and little me's in this thing. This is I just have a skill to help you get to your skills, if that makes sense. So I thank y'all so much for being attentive. And Miss Lydia, you were back on here.
I'm here. I'm here.
Thank y'all.
Thank you. Um, this has been so great. I met you since when I started therapy, and you have been so great. And y'all, for real, she do talk this way all the time, all the time.
You know, I ain't want to share that information, but you.
I don't mind. I don't mind. We all need someone to talk to every now and then. And so I appreciate you. You are a great blessing to my life.
Thank you
And
so
thank you
much,
so
Miss
much.
Lydia.
I'm so
And
glad
thank
you
you.
came.
And I'm thank you for blessing me to be here. I appreciate
Mm.
you. I appreciate you.
Well, I've enjoyed this session so much. Guys, please check out the things that she told us about, the EAP, the MD Live, and the other one was uh,
Amwell,
Amwell.
Amwell.
There's some really good things that, and you can meet some really good people to
Mhm.
give you information and help you along the way.
Mhm.
Um, I appreciate you. Miss Shirley had one more comment. Real talk.
Real talk. Go ahead, Miss. That's what it's all about. That's what it's,
Real talk.
and it starts with real talk with ourselves.
Yes. Yes.
Yes, a
So
healthy real talk.
healthy. So
Thank you,
thank
guys.
you.
You
Thank you
welcome.
so much. We'll definitely be in touch, and I
Okay.
hope to have you back again.
Okay. Have a good day, you guys. Happy
All
Saturday.
right. Bye bye. Hi guys. So um, we are about to move into our next session. Our next session is a pre-recorded session from last year, but it was a very good session that I thought was there uh, that we should do it again. One of our speakers had a death in the family and was unable to attend today, but we are just going to continue now with Dr. Noel Gordon. And so we are back, and Dr. Gordon is here. Dr. Gordon, can you hear me?
Yes, I can hear you. Can you hear me?
Yes, we can hear you, and you look great, sir. Your picture is so clear and wonderful today. You know what I mean because
Thank
we
you
talked
so
last
much.
night. I'm so happy you're here. I want to tell you guys something
Thank
about
you,
Dr.
Lord.
Gordon for. I want to tell you something about him for a second. On last year, we were supposed to have this conference, and Dr. Gordon had volunteered to travel from his home to Maryland to do this conference. And so this year, when we were ready, Dr. Gordon was ready to join and give us words of encouragement and advice. So we are so appreciative that you joined us on today, Dr. Gordon. Um, can you say a few words so we can make sure everything is good with your mic?
Okay, testing 1, 2, 3. Can you hear me?
I can hear you. Sound good to me, sir. So we're going to start. I'm going to put your presentation up in 1 second, and we're going to start. And it's all on you. You have the floor, sir.
Okay, just before we put up the presentation, I'd just like to say hi. Excellent job, Sister Chapman, and to the prelate James. You've done an excellent job, and this is so very relevant what we're going to be talking about today. And the speakers who went on ahead of me, they did an excellent job, and I just like to contribute to the body of knowledge. Just a little bit about myself. I'm a man of the cloth for 25, 26 years, etc. Part of Rhema Life Center in Maywood, New Jersey. But I'll be coming to you from my secular professional domain, and that's the perspective I'll be coming from. I have been an educator for the last 23 years. I've started out as a substitute teacher, then I was a school teacher, a guidance counselor, I was a high school principal. I've worked as a guidance director, a curriculum director. I currently serve my school district as the district supervisor for student affairs. And I'd really like to talk to you about something that's very relevant. I've had some training in this area. I've studied counseling. I'm a certified counselor on public education, and I gained my terminal degree at Nova Southeastern University in Florida at my doctoral degree in education as a student in educational leadership. So I want to come from that perspective. So without any further ado, because time is of the essence, I'm going to be really no frills and just get to the point because I have a bit of information that I'd like to share with you today. So if you could start with the first slide. for me, please, Sister Chapman. That will give us an idea of where we're going. So we want to be talking today about the merits of mindfulness. Can it be a little bigger? Can you go to the slideshow if possible, so at least we can, yeah, that's better. We want to talk to you about the merits of mindfulness, and the next slide will share my objectives. To talk about my objectives, first of all, gaining insights into the cause and effects of mental challenges, understanding the role of mindfulness and fostering mental health, and thirdly, highlighting of interpersonal best practices for mental, physical, and spiritual renewal. And that's my objective. And if we go to the next slide, this is steeped in the Word of God. Now listen what 3 John 1 verse 2 says from the King James Version. Beloved, I pray that you may prosper in all things and be in health, just as your soul prospers. So in other words, you can be great spiritually and serving God and all this wonderful thing, but you're not prospering in other aspects of your life. That's the Bible. So the fact that you're a great Christian and you're serving God, it doesn't mean that you are prospering and the other aspects of your life are okay. The New International Version says, dear friend, I pray that you may enjoy good health. You hear that? And that all maybe go well with you, even as your soul is getting along well. So you get the point, right? And then the Contemporary, which is the version that I absolutely love, one of my favorite versions, it says, dear friend, I pray all goes well with you. All. I hope you are strong. I hope you're as strong in your body as I know you are in your spirit. Did you get the revelation there? So it is so important for us to understand that we need to be holistic. In general, mental illness is considered to be a disorder affecting one's mood, one's thinking, and one's behavior. The term mental illness covers a broad range of disorders from mild depression to schizophrenia to it sometimes goes beyond that. You know, it impairs a person's ability to think, to feel, to process, and respond to life situation in appropriate ways, right? Our brains are physical organs like lungs and kidneys and are all subject to illness and damage just as the other organs are. However, because our brains control everything we do, their malfunction can distort our perception, leading to hurtful and harmful thoughts and actions. So we have to pay attention to our brain just as I would pay attention to the other organs of our body. Okay, God has compassion for our struggles. Okay, He can help us learn to manage mental illness in every way. So mental illness is still not fully understood by the medical professionals, and may have a variety of contributing factors. Some factors that contribute to mental illness are physical, such as brain abnormalities, hormonal imbalances, neurotransmitter impairments, and even things such as nutrition, exercise, and sleep affect our mental health. So it's not just a demon, it's not just the devil. All kinds of situations can impact our mental health. Other mental illnesses are brought on by traumatic events or by abuse. Sometimes you're abused as a child and it impacts you as an adult. So proper medication and competent therapy can help alleviate these symptoms. Sometimes a coping mechanism that was helpful in one situation gets carried into later life where it is no longer useful or adaptive. So you're not able to handle the situation as well as you were able to handle it when you were younger. Also, consider the way our behavior feeds into our physical health, and our physical health feeds back into our behavior. So if we are not well physically, it impacts our behavior and vice versa. And sometimes unhealthy behavior causes our bodies to be unhealthy, which in turn leads to more unhealthy behaviors. This is a very difficult cycle to break. Sometimes our own inappropriate behavior contributes to our mental illness, right? When we live upright lives, we can bypass some aspects of mental illness and know better how to respond when we do encounter mental illness in ourselves or when it's encountered in others' lives, so we can assist them. So mental illness has another factor that has not often considered in designing treatment programs. Much of what we call mental illness has a spiritual component, right? That if it's left unattended, it can impact us negatively. So some of the mental issues that we have to deal with, it stems from a spiritual problem. A study from Dartmouth University this July found an immediate negative impact on the emotional well-being of college students due to the COVID-19 pandemic and its social implications. In addition to, according to the recent survey by the Active Minds survey instrument, 80% of 2,086 students surveyed reported that COVID has negatively impacted their mental health. 55% of those students do not know where to go for support, but they stated that tools that promote social connection are most helpful in caring for the mental health if they knew where to get them. So people are struggling mentally, have emotional problems. They don't know exactly where to go to get the help. And there are ways we can support our loved ones to give them the best chance to stay mentally healthy. And that's where I'm going to be heading today. For instance, some children and adults have enjoyed being off school or work while others struggle to stay home. And we have been dealing with that because I work in the public school system. And many of the students, some of them came to our schools the other day to pick up their books, and you could ask them, "How are you feeling?" "I'm tired of staying home. I want to be out. I'm happy to be here today." So that could lead to mental, emotional problems. Other folks may be coming to terms with family problems, including loss of loved ones, because there are many people who died prematurely because of the COVID situation. I know a couple of people who have passed on, which is so sad. So I want to talk to us here about mindfulness, the merits of mindfulness. And mindfulness falls under the umbrella of what we call social emotional learning. And I want you to follow me because this is a new terrain for some folks, but I want us to get it, especially in the religious community, because we are good with the word. We can preach the Bible, we can get people saved, but many people in the church environment today are struggling from mental issues. The preacher cannot address the mental problem that's unrelated to spiritual things. What you're doing here, Apostle James, is commendable because you are getting the help that people need. There's a problem in the church. We don't treat our mental issues. That's what I want to talk about in the time that I have. I want us to understand that we have to pay attention to the mind. So we've got to understand social emotional learning. This is something new we have to learn. The answer to the pandemic in the church is not to preach Daniel 70 weeks and the coming of the Lord with all this fear-mongering situation. People don't need that right now. What people need is a way to be comfortable and to live their faith and to help them with the mental issues. So social emotional learning is a process for learning life skills, including how to deal with oneself or others and relationships. Slide 4. Relationships and work in an effective manner. In dealing with oneself, social emotional learning helps in recognizing our emotions and learning how to manage those feelings. And that is a problem. People don't really know how to manage their feelings. Let me talk a little bit, if you go to slide 5, the purpose of social emotional learning. The next slide says, it helps you to understand and manage your emotions. It's to set and achieve positive goals. It helps you to feel and show empathy for others, because not everybody is empathetic. Empathy means putting yourself in the other person's position. It helps us to establish and maintain positive relationships, and help us make responsible decisions. And when you understand a social emotional learning, then it helps you to do a number of things. And that's why I'm talking about this today. And there are certain competencies which we all need to have. Unfortunately, many of us, we are good with the vertical, but we're not good with the horizontal. We have to learn to function horizontally before we can function vertical. And that has to do with the mind and the mindfulness. So let's look at the competencies which we gain when we understand social emotional learning. The next slide. Okay, we learn self-awareness. Do you really understand who you are? Have you looked in the mirror and, whatever feelings you might be dealing with, whatever proclivities you may have, whatever things you might disdain, are you really aware of yourself? And self-management, not many people are able to manage themselves. There are many people who are experts in the invisible. Experts in the invisible. Love God, big in the church, but they haven't done anything with their lives out there because they don't know how to manage, how to operate in the marketplace. So that's one of the things with social emotional learning. One of the competencies, then social awareness, aware of your environment. Be aware of what's happening out there in society today. Social awareness. Don't just look at what politicians are saying to you and trying to use Christians in the political arena and advance certain things where they don't advance other things. Yeah, it's good to talk about we are against abortion, but what about the kids who are born and there aren't resources for them? What about the thousands of our young men who are in jail and we don't have resources to get them out of there? But are we more concerned about the unborn child than we are for the born child? It's all relative, So we should be socially aware, right? And relationship skills, we need to understand interpersonal relationships and also responsible decision making. So this is what we're talking about when we really talk about social emotional learning. So let's get to the meat of the matter because time is of the essence. Mindfulness. What is mindfulness? Mindfulness is a way of learning to relate directly to whatever is happening in your life. You're able to handle it so that you can experience a greater vitality, a greater vigor, a greater energy. You can be lively and not sad, and your well-being, greater well-being in this present moment. So you don't wait until you go to heaven to be with God, to be happy. You can experience that now, but you have to have a full understanding of mindfulness. Mindfulness is the psychological. I know the church people don't like to talk about psychology, many church people. When I came to the psychological field, not many people liked it way back in the day, but now people are getting more amenable to the idea. So mindfulness is an emotional, mental, inner, and spiritual process of purposefully bringing one's attention to experiences occurring in the present moment, whatever you are dealing with now, okay? Bringing your attention. Don't put it on the back burner. Don't bury it, but deal with it in the present moment without judgment. Stop judging yourself. Stop being too hard on yourself. If you have a bad thought, don't hit yourself over the head. It's natural to have a bad thought, but they said you could allow the birds to fly over your head, but don't let them pitch in your head. Okay, so you embrace that. Stop judging yourself. Yeah, you develop that through the practice of prayer, meditation, and through training. What we're talking about now, this is some kind of training that I'm trying to give to us. So that's the purpose of mindfulness. It is a scientifically proven. It's scientifically proven that meditation combats stress. Now we are so anti-meditation. If you read through the Psalms, you see they will always meditate. You know what I'm saying? We just like to pray for 1 hour and just, Lord this, Lord that, Lord that, Lord. We don't even stop to listen. How can you be talking to God and don't stop to listen to God? Learn to be comfortable with yourself and learn. Sometimes you should just sit with the dim light, get a blue light, or red light, or yellow light, get into a room, just sit and just focus without saying a word. Learn to do that. That's supportive mindfulness. Improving mindfulness is about understanding yourself as being in the moment. We need to we're always looking, what's going to happen tomorrow, what God has for me, what I'm going to do in life. But how about stopping now and just understand in the moment that you have right now, just deal with the moment that you're dealing with. All right? Stay in the moment. With this improvement, we become more mindful of our actions and learn how to express and interpret our present environment. We should be able to interpret the environment You know, we talk about psychological warfare. We're not good at that because we take things at face value. We have to learn to interpret the environment, right? Understanding what's not being said, feeling the energy, you know, feeling the spirit of what's around you. I'm not talking about the Holy Spirit now. As human beings, I believe in energy. I believe that you can sense, you can feel, you can be perceptive. This will create positive connections and increase self-regulation of attention and personal experiences. Improving mindfulness will provide benefits for the personal lives of both children and adults. Improving mindfulness through gratitude. Okay, be thankful. Filtering out the negative stuff. Active listening. That will give everyone the advantage of seeing things in a new light. So let's look at the benefits of mindfulness. Next slide. The benefits of mindfulness. Now, mindfulness is it helps you to manage stress and anxiety. Aren't we all stressed out at times? It strengthens the mental health and attention. Okay, it helps us to model a passion and kindness, compassion and kindness. It helps us to cultivate awareness and balance. It helps us to foster empathy and connection, and it helps us to grow in resilience. If you watch my social media, you always see me by the river. Sometimes I just leave work or whatever and just go there and just look up the water. I go through the hills. The other day I went there and I saw a bear. Fortunately, he was on the other side of me. I was intimidated, but you've got to find ways of falling in love with yourself and growing resilience, etc., etc. Now, you've got to understand that you are the priority in your life. Stop running around and taking care of everybody else's business and doing everything for everybody else when you're left empty. Stop. Because people will take and take and take and take. And if you are inclined to give, you'll give and give and give, and then you're left empty. You've got to take care of yourself. Now, another aspect of mindfulness has to do with trauma-informed care, because many of us, we've had bad experiences in our lives and we didn't deal with them, okay? We didn't deal with them and they come back to haunt us. So let me talk a little bit about trauma-informed care now. Let's talk a little bit about trauma-informed care, and I have to just move it because that's so little time. Can we get to the next slide? Trauma-informed, slide number 9. Thank you. So trauma is a psychological and physiological. It's both physical and mental, inner spiritual response to any deeply unsettling or threatening situation. So sometimes your body responds to trauma, and sometimes your mind responds to trauma. There are many people who have stomach aches and pains, and sometimes I go to work or I go to the supermarket or whatever, and when I get back, I'm feeling like my chest is tight because I was hanging out with people. I'm wondering if I have COVID. God forgive me. And you breathe in and you hold it, but then after a few days, you don't feel it anymore. That's a physical response to stress or trauma. And sometimes there's an emotional response. There was a young man who lost his father, and he didn't want to go to his home because every time he got to his home, he would see his father walking from room to room. And I gave a presentation in the church, and I said that one of the things that happens is that your mind will bring back things that are really not there. And after I educated him and the church on the impact of trauma, that day he went to his home. He never saw his father again. He wasn't really seeing his father. But that's what trauma does to us. These situations can range from COVID-related trauma to family dysfunctions, child abuse, and neglect to being neglected by your relatives, etc. Or you may have a serious car accident, and ongoing adversities such as discrimination, bullying, violence can cause trauma. I believe that black men and women right now, minorities, are going through a lot of traumatic situations because, I mean, when I go on the road and I hear a police car behind me, my heart beats as a grown man as I am, because I don't know if they're going to shoot me. And not all the cops are bad, but there are some bad cops out there. It's systemic. So there are lots of traumatic situations that we have to deal with. So if we go to the next slide, trauma, we as leaders, and this is where I want to commend the pastors and all these churches that are holding. This is not the time. Yes, you may want to have a 3-4 day fasting and prayer and commitment and dedication and all this kind of stuff, but you got to get beyond that. That's not the answer. That's not the post-COVID expected from the church. Because if you just continue to do this and not to do this horizontal, you're going to end up with a church full of men. So a trauma-informed approach to social emotional learning in dealing with the situations that we are facing, with community resources like what Apostle James is doing right now, that are equipped with the vital skill sets. All these professionals, they were all empowered. They're in the field, they're in the marketplace, and they're able to bring good information to other trusted professionals to help guide the family and community through short and long-term effects of trauma. So this is not the time. Now it's not the time to send for the celebrity bishop or the celebrity preacher to come and address your church on traumatic situation. And no, they can preach you into heaven. You need to get professionals. And some of these professionals are right there in your midst. Get them, use them. This is phenomenal what's happening here now. We are living in serious times. When it is known that someone has experienced trauma, the support services like the church, etc., or the, whatever it is, they're better able to prepare to support the emotional needs. When they are aware that the need exists, the church should also be better prepared to support the emotional needs of its parishioners. Okay? Church should be better prepared. I know I'm moving fast, but I need to get it in. Traumatized people often behave in ways that may interfere with the climate and culture of their environment, whether it's home or church or school or whatever it is. The climate and culture is impacted if there is a lot of problems happening in the mind. It can also directly affect the behavior and attitude of those in the environment, because hurting people hurt people, and then it has a domino effect, and then it becomes a toxic environment. And maybe nobody's really bad, but it's just that people can't handle the mental issues. So providing support and understanding after a traumatic event can help to the recovery process. Now, let's take a look at the trauma-informed approach. Slide 11. Trauma-informed approach to leadership. And take note of this if you're listening to me and you're a member of the club. Trauma-informed leadership. Trauma-informed leadership. Having an awareness that it exists. It builds positive relationship among the family members or among the parishioners. If you understand what's going on, these relationships are even more important for those who are experiencing trauma. So leaders and influencers must create opportunities for those in the spheres of their influence to talk about their experience. It's time to talk to people. In our church environment, we do a lot of talking. Our Bible study is no longer someone teaching. We choose topics, random topics, and each person in the study is required to give their response to it. And we have a night we call the hangout night, where we go on Zoom. Everyone who wants to join it from a church, they go on there. It's not a prayer, it's not a Bible study. People just go on, sit in their chair, grab a cup of tea if they want to grab it, and they just talk. Yeah, they just talk. So we have to do more interaction. There needs to be more interaction among people in addressing this trauma situation. Now, this helps us to understand how people are feeling and how the positive interaction might impact their behaviors and their mental health in general. People just need to talk some more. Understanding the reason behind human behavior can also help us to respond with empathy, right? So we should create opportunities for thoughtful interactions. Can I say that again? We should create opportunities for thoughtful interactions, not just frivolous interactions, but gut level, thoughtful interactions. We must response to what they're having to say. Lord, touch this thing that we don't have a buffer. I don't need a buffer right now. So traumatized people often behave in ways that may interfere with the church, with the home, with the work, or the school environment, whatever environment. Hence, in this pandemic season, we should be specific about relationship building. Can I say that again? We should be specific about relationship building. We got to build relationship. Now is not the time to be teaching Daniel 70th week on the red heifer in Jerusalem. Now it's time to build relationships. You hear me? That's how we're going to help our people. Let's go to slide 12. How can leaders help traumatized people? First, recognize that people are going into survival mode and respond in a kind, compassionate way. Cut out those rough preaching on those rough rebuking. Even if people do crazy things now, calm down, take it down. I'm not saying we shouldn't preach about hell and hellfire, but now is the time to preach about love and let people know you're helping them, okay? Create calm, predictable transitions. Praise publicly and criticize privately. Orient your church, if you're a church, to adapt to a mindfulness mentality. Don't be rough on others. And if people act crazy, give them a break. Don't buy into negativity. And the last piece I want to say on that is take care of yourself. Did you hear me? Ooh, I'm moving. I get there. Take care of yourself. This is like a whole day seminar. You know, that I facilitate this. I could have facilitated this an entire day. I'm giving it in 40 minutes, so just bear with me. I'm moving. Let's go to slide 13. Let's talk about the parents' well-being, because understand that, you know, it's not just the kids that are going through situations. It's not just children that need guidance. Parents need guidance too. Parents should ensure that they are looking after their well-being, their own well-being. And here are some of the best practices that you can encourage in parents to help them improve well-being in their children. Share your worries and seek out support from friends and family. Live a healthy lifestyle by eating well, cut out this whole lot of carbs and meat, exercising, having fun, and getting enough sleep. I need some more sleep. Stay well informed by finding out more about the topics that concern you. Google, find it out. Never stop talking and listening to your child through good times and bad times, and please be non-judgmental. Let's move on a little bit more. How you and your child, let's talk about the parent and the child. How do we deal with this interaction? Let's go to the next slide. You and your child. Okay. Make sure that they know you love them and are proud of them, even when things are busy or stressful and it feels like you are in survival mode. A word or a hug can reassure them and make them feel that they have a support system. Praise them for what they did well and encourage them to try new things. So make sure you build that relationship. I know you stress out, but stop, don't yell at your child. Okay. Number 2, be honest about your feelings. You don't have to be perfect. We all get things wrong and shout or say unkind things from time to time. Apologize. I apologize to my kids all the time. Okay. If this happens, say sorry to your child afterwards and explain why it happened. They will learn from you that it's okay to make mistakes and that it doesn't make you a bad person. So you have to be honest with your children. Number 3, be clear about what is and what isn't acceptable and tell them why. Children need to know what is okay and what isn't, and what will happen if they cross the line. So because it's COVID, don't let up on your discipline. Follow through on what you say, otherwise they will get confused and they will step over their boundaries. Don't say, I'm going to address this situation this particular way, and then you didn't do it. Okay? And own your own role. You are the parents, so don't be afraid to take decisions. Let's go to the next slide. I'm pushing through this because I want to finish it. We're almost there. Helping your child. Worrying or difficult behavior might be short-lived. So when your child, even if your child does something wrong, cut the child a slack. Don't be, don't be so rough and tough. The letter killeth, but the spirit giveth life. Go easy. Talk to your child. With older children, they might not want to talk first, so you have to find a way of getting it out of them, and ask your child what they're thinking. Ask them and ask them what they think will help. Listen to them. Don't just dictate to them. If you can, talk to your child's other parent, your husband, your wife, your significant other, and so that you're on the same page, so that you are not saying one thing to the child and the other person is saying another thing to the child. So you have to talk to the other parent. Let's go to the next slide. We're moving it. Look after yourself. And this one, I want to emphasize this one. Look after yourself. Can you all say with me, look after yourself? Listen, if your child is having problems, don't be too hard on yourself or blame yourself. If things are getting you down, it's important to recognize this. Don't take yourself on a guilt trip. Friends and family can often help, and don't be afraid to ask them to have your child for a bit if they are COVID-free. If you need to take some time to sort yourself out, sometimes you just need a few minutes. It's easy to say, take some time for yourself, but in reality, sometimes it's difficult. And the other thing I'd like to say, go to your doctor, go to your general practitioner. Let them check up on you just to see if everything is all right. Let them do a blood test. Let them, share with them what's happening to you. And I have just two more slides to go. Go to the next slide. Top tips to support children and young people. Okay, pay attention to this one. Be there to listen. Regularly ask how they're doing, and so they get used to talking about their feelings and know that there's always someone to listen. Get them to talk, because if they don't talk, they're going to recluse and they could do some crazy things. Find out how to create space when they are open, when they're not open to conversation. Next, stay involved in their lives. Stay involved in their lives. Show interest in their life and the things that's important to them. It not only helps them value who they are, but it also makes it easier for you to spot problems and support them. If you know your child, you won't spot when something is happening. Take what they say seriously. If a child says, I'm going to share this with you. I'm closing. So many years ago, when her son was a little boy, he said, I'm leaving home. And my wife said, okay, you want to leave, leave. You know what my son did? He was a little boy. He went through the door. He went out went all the way. So I was behind him. He didn't know I was there. And he went all the way, and I was watching him. And then I think it was a cop, the siren or something was off. He got afraid and he went back home. You better listen to your children. If your child says, I want to kill myself, don't say, cut out the foolishness. No, listen. If a child shares an emotion with you, you've got to listen to your child. Take what they say seriously. Encourage their interest. Don't try to live vicariously to your child. If your child doesn't have to be a clone of yourself. None of my children are doing the things that I did in life, that I'm doing in life. They have their own path. And build positive routines. Let me just quickly mention that one. I'm closing out now. Believe me, I'm closing out. We know it still may not be easy, but try to reinforce structure and regular routines, healthy eating and exercise. Try to make sure you get your children, even though they are home. The reason we have gym in school is to get physical activity. Get your child, walk with them around the house, go down to the park and do something, get them out of there. A good night's sleep is also really important. Try to get them back into the routine, because schools are going to be open up sooner or later. You could take the PowerPoint down. Thank you. I'm closing out. I know that I went through this very swiftly, very briskly, because I think it was important to me to give you that information, because we don't focus on these things, especially in churches. We are very, very, our greatest strength has become our greatest weakness. The emotional component. Yes, nothing like going to wonderful time and praise God on the choir and all of that, and praise break and all that wonderful stuff, but that's all emotional, and some of these emotional releases that we are doing is not really the Holy Ghost. It's just our emotional response to the love of God. There was a lady who once went on the bus and she saw this other lady and she started speaking in tongues and rebuke her and bind her in Jesus and go back from whence she came. This is a true story. Guess what happened? The lady had a twin sister who died. So when this Holy Ghost lady got on the bus and saw this lady, she thought it was a ghost of the lady who had passed. So she started speaking tongues and rebuking her. You know, she got anointed. We call it anointing. Was that it? That was the Holy Spirit? No. It was her responding, her response, her emotional response to the Spirit of God inside of her. Because I'm sure God knew that the other lady had died and probably was in heaven, and this one was the other sister. Holy Ghost doesn't make a mistake. So many of the emotional stuff that we do is really nothing to do with God or the Holy Spirit. It's just our approach and our response and our culture. We cannot just focus. That cannot take us through. Listen, I'm closing up with the same scripture that I started with. First, 3 John 1 verse 2. Beloved, I pray that you may prosper in all things and be in health, just as your soul prospers. International version. Dear friend, I pray that you may enjoy good health and that all may go well with you. All may go well with you, even as your soul is getting along well. So you think that because everything is all right with you spiritually, that everything is all right totally, you make a bad mistake. And the contemporary version says, dear friend, and I pray that all goes well. I hope that you are as strong in body as I know you are in spirit. So this is mindfulness that I talked about, the importance of mindfulness. I trust that you have gained something from this. And my closing words to you is that you're made up of 4 components: the physical, which is the body, the mental, which is the mind, the spiritual, which is the God conscious component, and the social component. Many of us, we are good in the spiritual component, but there are 3 other components. Are you taking care of your physical self? This is not politically correct, but if you're overweight, you're not taking care of your physical temple. Listen, your greatest spiritual responsibility is taking care of your body. Let me justify that. The Bible says that your body is the temple of the Holy Spirit. So if your body is what entertains the Holy Spirit, how comes that's not your greatest spiritual responsibility? Because nothing else is able to take place if God's presence is not with you and within you. So you've got to, starting today, you got the spiritual piece right. Most people take care of your physical. Start walking, start running, eating differently, and take care of yourself. There's no exercise. Don't tell me that you have big bones. I've never seen a fat skeleton. That's one of my corny jokes. Okay, so you take care of the spiritual, you take care of the physical, you take care of the mental. Your brain is an organ. Go see your psychologist, see your professional counselor. Stop acting crazy. You know you're not right. You know you're not firing off all cylinders. All of us at some point in time messed up. All of us will have a little crazy inside of us. You just need to make sure that you take care of your mental. And the last one that I want to talk about, take care of your social dimension. Do you have a social life? Get a social life. I didn't have one for years, but I've been very purposeful that now I'm building my social life. You know, when Jesus Christ went to that woman at the well and, you know, she had a problem, Jesus interacted. There was a social connection, and that woman found somebody who, you know, who would accept her for who she was and not judge her. And look what happened to the woman's life. So I'm hoping that you gained something. It was fast, but I hope you got something. The merits of mindfulness. And I was talking about the other aspect of life. You can live a great life. You can live your best life now. Thank you so very much, and God bless you.
Thank you, Dr. Gordon. That was great. That was great. I mean, the information was wonderful. A lot of times, you're right, we're walking around in pain due to stress, especially now with COVID. You know, it's no need of not talking about COVID because it's right here in our face. So every topic you come up with, COVID is going to sneak its way in there because it's right here, and it is affecting all of us. Even when we don't say we're stressed, there is a certain amount of stress that we're feeling when we go into just out to the market, just out to get the mail. You don't know what's going to happen, but we thank you. We thank you. We thank you. You did an awesome job.
Thank you.
And your time was wonderful. So it was no worries on the time. We're great. We're going
Okay.
into lunch break from here. So, if you had gone over, it wouldn't matter because the next thing we're going to do is lunch. But thank you. We will have you back. I am 100% sure of it. Just to keep the conversation going because right now that's what people need. They need the conversation. Like you said, they need to keep talking because when we close our mouths, a lot of times we keep things stuffed down within us, and it's not good for us physically or mentally. So we appreciate you so much. We thank you. We thank you. We thank you. We thank you. We thank you for being willing last year, and we thank you even more for coming back this year.
Thank you.
People have enjoyed you. There are a lot of wonderful comments here. I'm going to share them with you here for a minute. Miss Lorna has said the merits of mindfulness. Awesome word, Dr. Gordon. Karen James she shared with you. You have been very instructive, educational, and informative. Your intent to education and enlighten. Thank you. So we have so many comments here. People just have enjoyed your presentation and your jokes. So we thank you. We thank you. Everybody, I'm going to say goodbye to Dr. Gordon. We'll see you next time. Please don't log off completely. Watch the rest of the sessions today.
Yeah.
And thank you again. Hi, everybody. We're back. That was an awesome session with Dr. Gordon. Last year it was great. It was good this year. We were definitely blessed by the information that he shared, the merits of mindfulness. Let's see here. Okay, I think I got stuck for a minute. My internet got stuck for a minute, so please excuse me. But that was a great session. Today has been wonderful. We've had from 10 o'clock this morning all the way until right now, we've had excellent speakers to come on. And I want you to understand that we are here for you no matter what's going on. You can always contact us here on the Legacy Fellowship channel, on the Barnes Memorial channel. We have so many different pages that you can contact us on, but we are here for the conversation. We are here to just, talk about it because, in our current environment, everyone has something that they need to talk about. And that's why we have therapists. God put doctors here. And sometimes we think because we're spiritual people, we don't need to go to the doctor. Well, I'm here to bust that myth up today. You can be as spiritual as you want, but sometimes you need to talk to somebody. Luke in the Bible was a doctor. So that lets us know that God has nothing against doctors because one of his apostles was a doctor. Let's not get so spiritual that we are no earthly good in this life. And someone to talk to can help you. Like I said earlier, you can talk to a friend, you can talk to a counselor, but talk. Because when you stop talking is when it gets inside and it gets bottled up, and it can lead to other illnesses that you definitely don't want. We tend not to talk in our community about mental health, but we need to express what's going on. We need to express how it's affecting us. We are not exempt. We do have mental health issues in the African American community. And if we deal with them, we can see some of the things that happen in our communities change. And let's not stigmatize mental health. It's not a stigma. It's not something bad. It's something good. When we discuss it and it's out there, it brings the conversation up and it helps someone. And I pray that everything that's been said today has helped someone. Someone has been edified or just helped to know that there is help for you out there. Our next speaker is here and she is waiting in the wings. I'm going to bring her up now so that we can go into our next session. Our next speaker is Miss Ebony Vaughn, and she is not a what you say? She's not a foreigner to us, but she is definitely one of my very favorite friends here when it comes to mental health. And so let's. Hi, Ebony.
Hey, how are ya?
I'm good. Our last session finished a little bit early, about 10 minutes early.
Okay.
But since you are here, which I am so happy about, we can get ready to move into the next session. I was saying that we don't talk enough in our communities about mental health. We really just don't. It's been, I know when I was growing up, it was something that we didn't talk about. That was something other people did, but not us, because we don't have issues, you know. I don't know if it was our skin or what, but we didn't have issues. You know, we
Yeah,
didn't think we had issues. And we probably should have started talking to people a long time ago about the
I,
issue. We should have
I
started
agree.
a long time ago, because when you get into that conversation, you'd be surprised the things that we're holding on to in the back of our heads that is affecting us and keeping us from moving forward. You know, and so I'm so happy you're here, Ebony. I'm always happy you're here.
I'm
I
always
really am.
happy to be called upon by you. I'm just excited. All of the information, everything that I've heard today, it's like I was gonna say that. I was gonna say that. It was like, you know what? It was good. I mean, and the way that Dr. Gordon just kind of brought it all together, I believe it was just amazing. Hmm.
Dr. Gordon, he is, I mean, his was a pre-recorded session, but it was so good, it was worth playing again, because
Absolutely.
he just, he broke it down, you know, like really into those really small pieces that you can digest. And a lot of preachers say when you break it down to where children can understand. And I think his session was one of those. All of them have been really today, but his session from last year was one of those that you can break down into tiny bites over time and digest them in different situations and different circumstances. They're still there to help you just about merits of mindfulness, because yeah, we don't think about a lot of things, but it's like bring it back to your memory. Hey, this is what this is causing. This is how it works. And he went from the adults through the children. It was so great. I really
Hmm.
enjoyed him. I'm going to step out of the way because I know that you have some great things to say. And I have to tell everybody, I'm going to say this because I do this every time Ebony's on. So, guys, Ebony has a new book. She is a 4-time author now, Ebony.
Three time, three
She's a
time.
3-time author now. So she's going to be a 4-time author. That was just a fact. She's a 3-time author, and please check out Vaughn Therapeutics and Triple G Living. And I'll put it up again at the end, but I did want to say that because I'm so proud of Ebony. You guys don't understand that Ebony is she is cranking out the books, man. Like, so I
Oh,
can't wait for the next one comes out. But I'm telling you, Ebony is like, you want a role model of someone who is a go getter. Ebony is a go getter. So without further ado, I want to introduce to some and present to others Miss Ebony Vaughn.
awesome, awesome. Thank you so much for just allowing me the opportunity to come on. You know, as I was listening to all of the sessions today, I just couldn't help but marvel at just how God is speaking to all of his servants as it relates to the importance of mental health. And it just continued to resonate in me. Third John 2, right? When the apostle John says, "Beloved, I pray that you may prosper in all things and be in health, just as your soul prospers." And I believe that today summed up all of that. It is God's will for our lives to live whole, right? It is God's will for us to prosper in every aspect of our lives. And the important thing for us to understand, even as we have taken in all the information that we have received today, is that it is our responsibility to participate in our wholeness and to be intentional about it. Dr. Gordon said something that I wanted to touch on today that I believe is very, very important. And that is that we are a three-part being. We are mind, we are body, and we are spirit. And it is our responsibility to nurture and to fill each of these areas in our lives. And so I'm not going to go into an in-depth teaching because I believe that he did an amazing job on that. But one of the things that I do want to touch on is just the importance for three things in each of those areas. In each of those areas, when we talk about mind, body, and spirit, it is important for us to have three R's. We have to have a relationship with the spirit piece, which is with God. When it comes to our soul, it's our mind, our will, and our intellect, and our relationship with ourselves as it relates to the way we think and the way we feel is important. When it comes to our body, the relationship that we have with our body has everything to do with what we feed it, how we speak to it, how we take care of it, right? So we're talking about we have to have unique and significant relationships with our mind, our body, and our spirit. The other part to that is we have to be intentional about replenishing each of these areas. So when you think of replenishing, it's all about restoration. It's all about nurturing. It's all about feeding it what that specific area needs. What do your spirit need? What does your body need? What does your mind need? When we think about replenishing, the word that comes to mind is rejuvenation. And so I looked up the word rejuvenate, and rejuvenate means to recondition and refresh and reinvigorate. And so when we think about this, I challenge and charge each one of you today to really be intentional about what kind of relationship do you have spiritually? What kind of relationship do you have with yourself? What kind of relationship do you have with your body? These are the things that we need to be intentional about. And then we need to be intentional about feeding it and mastering it. I believe, and someone talked earlier about the importance of management, right? And so we understand that self-awareness and management and mastery are all important components when it comes to mental health. But what I want to focus on is, what is your relationship to your body? What does that look like? What do you feed it? What do you fill it with, right? How do you care for it? And I believe that this conference today has everything to do with giving you practical strategies so that you can be in good relationship with your mind, your body, and your spirit. And so these are all the things that are important. The other thing is, so we've talked about relationship. We've talked about this whole idea of replenishing and rejuvenation. But then lastly, what are your rituals as it relates to mind, body, and spirit? What rituals are present in each of these areas of your life where care is taking precedent? What rituals are in place for you to feed your spirit man? What does that look like? And rituals is not always about going to church, although I believe that the ritual of fellowship is a part of us feeding our spirit and growing spiritually, but it's not the end all. So when you think about rituals as it relates to you nurturing your spirit, what does that look like? What are your daily practices to replenish, to be in relationship? And also, what are your areas that you restore your spirit daily? What does that look like? What are those rituals? What are those rituals where you are taking care of your body? What does those rituals look like? How do you feed your body? How do you care for your body? Are you exercising? Are you going to your natural checkups weekly? Monthly, I'm sorry, or yearly, or whatever the expectation is based on your body. What does it look like? Are you following a regimen that has proven to be successful as it relates to your body, your vitamins, iron, whatever that is? What is your relationship with your body? And then mind, when you think about mind, how are you feeding your mind? How are you renewing your mind daily? Are you giving yourself each day? Are you feeding yourself new information that can help you think differently, that can take you from one frame of mind to the other? How are you training yourself to align your thoughts with spiritually, where God's thoughts are? So again, it's all about relationship. It's all about rituals, and it's all about rejuvenation. What's happening, and how are you caring for this three-part being that God has created? Yes, God has created us to be three-part beings. So just as Dr. Gordon talked about in terms of, it's that posture, that relationship horizontally, and then also those vertical relationships. And all of those areas we have to develop. I truly believe that mental health is a God-ordained plan. A good mental health is a God-ordained plan for each of his people, but it's important for us to participate. It's important for us to be intentional about relationship and rituals and rejuvenating those areas so that we can experience refreshing daily, so that we can experience growth and development daily. These are the things that we have to do, and we have to make it a priority. The title of this section of this mental health conference is Mental Health is Our Priority. It's my priority. My mental health is my priority. It's your priority. But here's the thing, it's God's priority as well. And I'm looking at this verse that I read earlier, because what? John says, "Beloved, I pray that you may prosper in all things." And be in health just as your soul prospers. So we understand in the word of God that this is a God thing. It's a God thing, but it's important for us to participate. It's important for us to be intentional about feeding these areas. The other thing that is very important is that, yes, when we talk about the mind, the body, and the spirit, these are three parts of our being. But guess what? They can be in alignment. And so oftentimes what happens is when we are growing spiritually, our spirit man will enable all parts to align themselves. Right. And so it's so important for us to understand that alignment in three parts can only be found in a spiritual manner. It can only be found through that spirit being, because it's that spirit being that we're going to have to align ourselves with, because guess what? That's where truth resides. And so wherever truth resides, that's what we have to come into alignment with. Why do I say that? Because our mind is, as I stated, it's the soul. It's our thinking. It's based upon our experiences and what we are accustomed to. So it doesn't necessarily have to be the truth, but it can be our truth. And so it's so important for us to align the mind, our mind, with our spirit, where the Holy Spirit resides. Because wherever the Holy Spirit resides, it's truth, because the Holy Spirit is the spirit of truth. So you want to align your mind with your spirit man. And then when we talk about the body, Our body consists of what we have fed it. It consists of the natural, right? The natural conditions of this world. So if you have high blood pressure, or maybe you have been challenged with low blood, some of us are anemic, and some of us are challenged with these medical conditions that have ran in and through our family lines. So guess what? Now we have to align our body with what the Spirit of truth says, right? So God says we're healed. And so we have to begin to bring our bodies into alignment with what the Spirit of truth says. And then we have to participate in the process of wholeness. And what does that mean? Following the regimen that is good for your body, feeding it what it needs, taking the necessary care of your body so that it can be in alignment with your spirit. So we're talking about that 3-part being, and I'm doing this because it's like a circle, right? But here's the deal. Your body and your mind must come into alignment with your spirit. And guess what does that? Prayer. Prayer is, prayer helps us to align our mind and our body with our spirit. And then it's us that, and then the participation part comes with us, where we become intentional and strategic about feeding those areas. And I hope that makes sense, because a lot of times we want to separate them. And although there are distinctions in each one of them, because the Holy Spirit resides within us, we have the ability to align them all together. And it's about alignment. I want to read you this quote. There is a quote by E. Stanley Jones that says, prayer is aligning ourselves with the purposes of God. And so it's prayer. It's through prayer, right? Because prayer is the Spirit-filled believer's weapon, okay? Therapy is a strategy, but not necessarily a weapon, okay? And so again, when we think about prayer, prayer is needed to align all parts of who we are and who God has created us. It aligns us all together. And so that is what we want as a body of believers, as a Spirit-filled believer. Our pursuit should always be to be aligned, to be in alignment, mind, body, and spirit. It doesn't always happen that way, but all today, throughout this mental health conference, we have given you strategies. We have talked about the necessity of making your mental health your priority. We've talked about the importance of managing your emotions and mastering your behaviors. We've talked about the importance of understanding that you can't control everything. You can only manage you. You can only control you. And so again, bringing it all together, it's about becoming aligned, because guess what? It is a God thing. It is a God thing for us to be in alignment. And that is our daily journey, to align our mind with the mind of God, to allow our heart with the heart of God, to align our body, glory to God, with what God says our bodies should be. The Bible says that that our bodies are the temple of the Holy Spirit. So if we are a temple, glory to God, that houses the Holy Spirit, why would it not be all in alignment? Because our physical bodies are temples. Okay, and so because our physical bodies are temples, they should be consecrated. Glory to God. They should be nurtured. and they should most importantly be submitted. And so, in order for us to do all of these things, there must be a divine alignment of all three parts: mind, body, and spirit. And guess what? I am done. We have been rich, 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 rich with all kinds of strategies and information and wisdom that I believe can help us to begin, if we're not already, to be in alignment with our mind, our spirit, and our body. Thank you so, so much. And I hope that this was something that you can feed off of and that you can be intentional about. Remember, our three parts: our mind, our body, and our spirit. We must be in relationship with each of those areas. We must replenish each of those areas. And finally, we must rejuvenate each of those areas. And again, in defining rejuvenate, it's all about reconditioning, refreshing, and reinvigorating. The great thing I love about we spirit-filled believers, three-part beings, is that we are resilient. And each of these areas, we are able to align ourselves daily so that we can get the best out of our lives. This is truly God's desire. Thank you, guys. I can't hear you.
I was muted. Thank you, Ebony, so much for coming and sharing with us, because we are three-part beings. A lot of times we tend to forget that, and we cater to one and leave the others just hanging out there and wonder why things are not, going well. But it's because we haven't catered to the whole man, and the whole man is very important. I promised you guys that before Ebony left, I was going to share. So I'm going to put it up here. Please, Triple G Living, Miss Ebony Vaughn. She's the author of Fight and Gift. The name of the new book, Ebony, is?
So the name of my last book is Pursuing the Heart and Mind of God Through Prayer. It is a servant's lifeline. So it's all about prayer and just learning to just be more effective in prayer and more open to it.
So, guys, Ebony is October the 27th. Is that correct?
October the 29th is my my launch for my virtual launch for my new book, and I'm so excited. I was going back and forth as to whether or not I would do another launch, but I welcome everyone to be a part of that. It gives me an opportunity to talk a little bit about the book and God's instruction and mandate in writing it. So I'm so excited about that.
So, guys, I want you to check out. This is Triple G Living. I believe that her launch is going to be on this channel on Facebook.
Yes.
So please, October the 29th, we want you to flood Facebook, Triple G Living, to support Ebony Vaughn in this new book that she is just published. And don't forget Fight and Gift. They are both wonderful books. They give you such great information. Ebony, I love you. I can say that.
I love you too.
You are my sister. Oh my goodness. Ebony we have done so many mental health talks and forums, and I appreciate her because she is always willing to come and share. Ebony, thank you so much. I will definitely talk to you soon.
Okay.
And we are going to end the day. So I'm going to let Ebony go.
God bless you, everyone. Bye-bye.
And we're going to get into our final remarks of the day. Before we do that, I want to share, we have a short video that shows different mental health avenues that could help you. So I'm going to play this short video that shows different agencies that you may want to call or get in contact with somebody if you need to talk. Just watch the video, take notes if you need to, take down numbers, websites, whatever you need to do.
To see ourselves in each other, to find compassion and understanding and gratitude and grace. People need empathy. Families need empathy. Communities need empathy. At Crisis Text Line, we're powered by 10,000 people who are ready to show you empathy whenever you're feeling alone, who are there to see you and hear you and validate you and remind you that the world needs you.
Hi. So I hope that video gave you the important information needed to contact the different entities that are out there to help with mental health. We are about to have our final word, and I am actually a little giddy right now because our final word today is coming from Dr. Michael Barnes. Welcome back, Dr. Mike.
Hi there. Thank you very much. Thank you very much. I've been here all day.
He's been here all day, guys. He started us off first thing this morning.
And let me just tell you, I got a lot out of the speakers. I really, really did. I mean, it's one thing, you say, well, I'll prepare and I'll do my part or whatever. But then when you tune in, there's so much more that goes beyond my experience and beyond my level of expertise. So I really learned a lot as well today, as I did last year as well. So
great.
Absolutely.
I am so happy for that. I told you a few weeks ago, hearing your opinion means so much. So thank you for saying that, because we really endeavor to make sure that we bring on quality people to give out quality information that will be able to help throughout this year and years to come. And so, yeah, with you saying that, that was thank you. That means so much. I appreciate you so much. I'm glad that you came back.
Well, let me just say this too. I want to point out the fact, and in our conversations, you pointed out to me, and I can now verify that everyone who spoke is credentialed. I mean, these are not just people with an opinion. These are people with experience. These are people with education, with experience, with knowledge, and we really need to take advantage of it whenever we can. So
Yes.
I just want to underscore that everybody, and go back and check it out. Everybody was credentialed. So you know.
And that's really the point. I'm really big on, and we are really big on making sure that it's not just about what we think, because a lot of times we can all give an opinion. A lot of times your opinion might sound real good.
Yeah.
To be honest, your opinion might sound great, but sometimes if you want people to take what you're doing seriously, you have to make sure you get serious people who are trained for
Absolutely.
the topic that you're going for. And that is always the goal, to make sure that we use trained individuals that knows what to do and what to say.
That's right.
And
And now,
so
and now have been there. I mean, have been
have
there,
been,
not just, not just
yep,
talking, have been there and really sharing with you. You know, I had one professor who told me years ago, he said, it's wonderful when you don't have to reinvent the wheel. You know what I mean? You don't have to always go back to square one, where you have people who have experience and have knowledge that can share with you. So now you can just take that and improve upon that, and build upon it. So, yeah.
so thank you, Dr. Mike, so much. I want to say that Dr. Mike is a part of Legacy. If you don't know, let me introduce you today. He is a part of Legacy. He is the youngest in the original six. That's what I call him. He's the youngest of the original six. And so I appreciate him taking the time, because he's not just my uncle, he is credentialed. And he's a smart guy. He's a smart guy. So without further ado,
Thank
I
you.
am going to turn the floor over to close this out to Dr. Michael Barnes, and then we are going to end for the day. Thank you, everyone who's come here today. Oh, I can't tell you how much I appreciate all of the speakers who were here today and the invaluable information that they have shared. And with that being said, Dr. Michael Barnes.
Well, thank you again. Thank you once again. Um, I want to go through and summarize some of the points I've made, and I've jotted down some notes as well, so you'll see me flipping pages and whatnot. But I also have included, so I've taken the liberty of including some things myself, some things that I think are important. And one of the things is that, if you notice, this conference began with prayer. So I want to suggest, emphasize, I wish I could mandate that whatever you do, begin with prayer. It is really so important. If you enlist God's help, I will guarantee you that there will be a success associated with your efforts. One of the themes that came through um, in today's conference is the importance of taking care of oneself. In other words, your own personal mental health is important no matter what. No matter if you're providing comfort or care to others, unless you're just friends with others who may be going through a tough time, it's important that you are okay. I suggested when I spoke that we take periodic checks of our mental health status, and I mean that. You know, I think that it's important that we just check in to make sure that we're okay, to make sure that we're using our strengths to offset our weaknesses, and that we can pass on to other people. Another theme that came through today with more than one speaker is the importance of finding a creative way of connecting with other people. Um, in psychology, there's a theorem called it's a hypothesis called the buffering hypothesis, and the buffering hypothesis says that when we have someone else to bounce things off of, when we have someone else to help us kind of cushion ourselves between ourselves and whatever else is going on in our lives, it makes it much easier to deal with. So I know that with the pandemic, thank God, it's some of the things have eased up and we're able to do more than what we were able to do this time last year. But if you don't, if you can't have direct contact, in-person contact with other significant other people in your life, nowadays that's no excuse. You can use all kinds of technology, all kinds of ways in order to connect with other people. Therapeutic sessions are now, insurance companies are now, no problem, able to give you what's known as telehealth, and you heard several speakers speak to that. Most of us will not need professional help, will not need psychotherapy per se, but some of us will. Some of us will need it on a short-term basis. Some of us will need it on a longer-term basis. Some of us will need things that, or we know people that need things that are much more serious. Hospitalizations, medications, and the like. It's okay. Please, please avail yourselves to these things. As Lydia said earlier, she said that, Luke was a doctor, you know, and if Jesus can have one of his, apostles as a physician, then it's good enough. It should be good enough for us. And the other thing is the ability to take care of our elderly. They are important. They're important to us. And nowadays, people are living longer and much more productive lives. But at the end of the day, they do need our attention and they do need our care. And you had some of the panelists, especially the panel that was right after mine, speaking to the idea of caretaking. It's serious business. I think that all of us need to be prepared to be caretakers. All right. And I also want to emphasize that it is a very, very, and I know from personal experience, it's a very demanding job. It's a very demanding position to be in. And so you have to be careful that you don't overwhelm yourselves in the process of doing that, as our speaker said. The other thing that you all were in for a treat today with Dr. Gordon, because Dr. Gordon was talking about what he actually does in his therapeutic practice. And that is, he employs this topic, this technique, if you will, called mindfulness. You got a first-hand view of what mindfulness is all about. And as they said, before, right after his talk, how he broke it down into small, digestible units. Please, if you have this, if you're able to review that somehow, please do yourself a favor and go over it. You actually probably saved yourself a few $100s with that particular lecture, because he actually ran it down, I'm sure, the way he runs it down in his practice. So be aware. And then the last thing that I want to end with is a matter of continuing prayer. Whatever you do, when you begin with prayer, end with prayer. Okay? I can't say it enough, especially now, especially forever. Okay, and having said that, I want to say that this has been a wonderful experience for me. This is my second go around. Hopefully, I'll be around for the next one. I'm really enjoying the presentation, the involvement with you all, and also learning, sitting in the student seat and learning from these other experts. But before I go, lastly, I want to give a special word of thanks to the courage, to the effort, to the foresight, to the what? She is really just committed to doing everything that she can do to better herself and to better her community. And I'm talking about Lydia Chapman. Lydia, thank you. Thank you for all that you did. Thank you for all that you do. And I encourage you to continue to do it. People are benefiting from it. And if no one else can admit it, I can admit it. I'm really benefiting from your efforts. So with that, thanks very much. And I hope you enjoyed and benefited from this conference.
And with that, we're going to pray our way out like we prayed our way in.
You go.
Oh God, we thank you, we bless you, and we honor you for this day. We thank you for everyone who has come on and shared with us on today. God, touch our communities, touch our families, touch this world at large, and touch us as we move forward, God. Touch our mental, physical, and spiritual health. Oh God, we thank you right now. We ask a special blessing over every speaker who has come today, God. Bless them for what they have given out to your people. We thank you for everything. Touch us as we leave this conference and help us to remember in the days to come what we have heard today. We thank you, we bless you, we honor you. It is in Jesus' name that we pray this prayer. And our soul said, Amen. Bye, everybody.
All righty. Thanks again.